Good morning, everybody. Welcome to the Service Delivery Committee. My name is Nick Barr. I'm a board member and the chair of the Service Delivery Committee. We've got an extremely interesting and packed agenda of, yet again, high quality papers. So thanks to all the contributors to that. We'll need to be fairly focused, I think, in our thoughts, comments, presentations, questions, etc., in order to get through this in the allotted time. So I just ask you to bear that in mind, both as presenters and as committee members when we are asking our questions. I'll try and give you some clear direction as to timings on that, if that may be helpful. We'll look to have a comfort break at around 11:30, and just a reminder of the standard operating procedures for these sorts of meetings. Now, we won't use the chat function, and if when you speak for the first time, you could just introduce yourself and subsequently then just by raising your hand. What I would like to do is do some welcomes. Excuse me if I'm just looking off to the right. I've got another computer screen here. I know it's slightly disconcerting when you're looking at the screen, but our committee membership has changed. Malcolm Payton has left, and I'd just like to really just record my thanks to him for his input. And that's been very valuable over the last few meetings. And then in his place comes Paul Stollard. Welcome, Paul. Nice to have you along. And you swap places with Malcolm, and you bring a wealth of fire-related experience with you. So welcome indeed.
Thank you.
No problem. I'd also, in his absence, really like to recognise that John Dickey is his last day of work today, I believe, Director of Trading Safety and Assurance. John's been an incredibly valuable member of the senior leadership team and a major contributor to this meeting over the years, all the years, in fact, that I've been chairing this. And I've really valued his vast experience and passion and dedication to the role, and the way he's displayed that within the bounds of this committee in particular. I know that's gone elsewhere, but also particularly within this committee. So thank you, John. And just for the record, I'll miss your input. Thank you. But on saying that, I'm also looking forward at the next meeting to meet Andy Watt, his successor. Also, welcome to others that are joining us: Bruce Ferguson, Stuart Nicholson, Mark Duffy, Robert, you're always more than welcome as the Chief Inspector, and Chris and David as well. So with no further ado, excuse me, have we got any further apologies for absence? Ali?
No, Chair.
Thank you. Item 3 then is any items that we consider to be necessary to be taken in private. We just have the minutes of the last meeting at the moment, and I'm not aware of anything else unless anybody else is. No? Okay, thank you. Declaration of interest then for the meeting, as standard rules apply there. If you have any, please let me know now. Robert, I've noted your hand there, and if anything become apparent during the meeting, then please flag that up. Robert, go ahead.
Thanks, Chair. Just the same declaration of interest as I made at the last meeting with regard to the Grenfell Tower inquiry in my previous role as a consultant for London Fire Brigade.
Okay, noted. Thank you. Paul?
I also have a declaration in regard to the Grenfell because I'm still employed to do some work on Grenfell.
Thank you, and thanks to both. And I'll be guided by you and your common sense approach to that. So if anything does occur that you feel that is of relevance to the discussion at the time, please let us know and we'll take the necessary measures. Let's move now then to item 5 minutes of the previous meeting, and I don't intend to go through it page by page, but does anybody have any comments to make about the minutes of the previous meeting? Stuart, please go ahead.
Thanks, Chair. Just a very minor point under 8.1.1, the first bullet point. I'm assuming the word is to be statistically comparable, not statically comparable, but just for clarity. I'm hoping it's statistically.
Yes, I think you're probably right, and apologies for not spotting that as I was going through the report. Thank you. Is there anything further, Stuart?
No, thanks.
Okay, thank you. That's item 5 concluded. Item 6, the action log. There were 2 items there. Ali, could you just quickly mention those, please?
Thank you, Chair. Ali Cameron, Group Commander, Board Support Manager. So yes, as you stated, Chair, we've got 2 actions, both of which have been marked blue as task completed. First one being in referring to the quarterly performance report for Q3 21-22, and you'll note that now on the forward plan we have a further item being added in relation to deep dives into home fire safety visits for the next meeting. And the second one being the operational clinical governance framework update. And as members will be aware, and they will note that this is on the agenda for today. So thank you, Chair, and just to confirm that they're happy that these are removed.
I am, and nobody has indicated otherwise from the committee, so that's great too. Thank you very much. Thank you. Thank you. That was a quick canter through the first 6 actions, and now item 7, the service delivery update report, and I'll hand over to the Deputy Chief Fire Officer, Ross.
Thanks, Chair, and morning, colleagues. As the Chair has said, I'm Ross Haggart, Deputy Chief Officer. I'll just say a very few words regarding this, Chair, and then hand over to any questions that committee members may have. And we've got a number of colleagues on the call today that will probably be able to add any additional colour to the report. So this is the now familiar service delivery update report. This particular report covers the period from the 5th of February to the 13th of May of this year. And as always, the committee is asked to scrutinise the detail that is provided within Appendix A. As I've said before, all of the things within here are worthy of note, but I'll pick out a few things that I think are probably worthy of particular attention. Very pleasing to note that the operational strategy went live on the 1st of April, which is the culmination of a lot of work that was led by David Farries as the head of operations under Stuart's direction. So excellent to see that document now live, and that will inform what we do in an operational context moving forward. I gave the board an update at the strategy day last week regarding the work that we're doing in relation to staffing, and there's a mention here of the staffing solutions team. Again, I'll not go into any great detail because I gave quite an update to the board last week, but happy to give any further detail on that as necessary. Quite a small paragraph, but something that's worthy of highlighting is the evaluation report that's recently been concluded on the Youth Volunteer Scheme. An excellent scheme and an excellent evaluation report, and I think it's been shared with the full board, but I thought it was worthy of highlighting to this committee because of the clear linkages between the Youth Volunteer Scheme and the Service Delivery Committee, and indeed the delivery of our services to communities. Sticking with service delivery, and really we got some really positive coverage in the press regarding 4 female on-call personnel at Invergordon, which is really pleasing to know. And there's also later on within the report a similar at Campbelltown as well, which again is testament to all the work that's getting done locally in order to ensure that we have got a workforce that is as reflective as we can of our communities. Moving on to the East service delivery, and you'll be aware from previous inputs from Robert that Robert's moving from a local authority area to an SDA area inspection for the local area inspections, and again pleasing to note that that's kicked off with some discussions between Stuart Nicholson and his team and Robert, and we look forward to that work progressing within the east of Scotland. I'd particularly like to highlight within the West update the partnership approach to water safety. I was fortunate enough to be able to attend the water safety stakeholder group a couple of weeks ago that's chaired by our Minister, the Minister for Community Safety, Ash Regan, and I would like to pay particular thanks to Group Commander Albert Bruce for the work that he's done in that field as Albert moves into retirement. He's done a sterling job over the past year or so in that arena, which is greatly appreciated by us and also by partners as well. Moving into training, safety and assurance, And the one area that I would particularly like to highlight, and Bruce is on the call if there's any further queries, is in relation to the continuous improvement programme, and a really positive update and quite comprehensive update at the end of the report in terms of the continuous improvement programme, in terms of those actions that have now been completed, those that are progressing, and some that have been transferred into other areas of the organisation. So, as I say, Chair, that they're all highlights within the report, but I thought I would particularly pick out those areas. I'll now pause and hand back to yourself and any questions that committee members might have. Thank you.
Thank you, Ross. I meant to say right at the beginning of the meeting, suite of papers we had highlighted to me yet again, and you'd think I would have gathered this by now, having chaired this meeting for 3 years or so, is the vast array of work that the teams do, one, and the scope also of the service delivery agenda for this meeting. So really excellent work, and this service delivery highlight report really gives us a small window into the vast array of work you do. So thank you very much. Colleagues, does anybody have any questions to ask about this service delivery report? Leslie.
Thanks, Chair. Leslie Bloomer, board member. Thanks, Ross, for that. Just 2 or 3 questions. Again, just share Nick's comments about it's a great report and good to see just the range of stuff that's going on. It's brilliant. Page 21 of 199. This is the MTA. Is it on page 21? It's page 20 of 199, 6 of 18. So you talk about what's happening with the response to a marauding terrorist attack model. Can you just talk to us about what our capability is in this area now with the change of arrangements that we have, please? Thank you.
Thanks, Leslie. I'll pass over to Stuart, and he might want to bring in David. So over to you, please, Stuart.
Yeah, thanks, Leslie. Stuart Stevens, Assistant Chief Officer and Director of Service Delivery. So, Leslie, as you'll be aware, we had the interim arrangement in place for COP26 up until 31st of March this year, which involved personnel from frontline stations, namely Stirling, Govan and North Anderson Drive in Aberdeen, supplemented by a cadre of flexi-duty officers and the NILO cadre that would support those individuals should there be an MTA type incident. Within the variations contract that we issued, we did put in a clause that we would look to explore extension of that should discussions with the Fire Brigade Union in terms of abroad and role in Scotland not progress in line with those timelines. And unfortunately that was the case, so we had to go out and do some quite considerable engagement with the stations in terms of extending that. And for a variety of reasons, the station personnel did not want to extend the MTA agreement, and it was primarily because they did not want to go against FBU policy on the matter. So that arrangement has fallen. However, we obviously had a plan B in place in case that was the eventuality. And what that looks like is around about 130-ish flexi-duty officers who will provide cover. So there's 24/7 cover within each service delivery area going forward for the remainder of this year. Again, variations to contract are in place or be put in place to support that going forward as well. So it's not the position that we wanted to be in, but it's a better position than we were before COP26. So I'm satisfied that we do have a response to MTA.
That's helpful. Nick, can I just have a follow-up, please? That's helpful, Stuart. Many thanks for that. When you were taking us through developing this capability prior to COP26, as I recall and as I understood it, which may not be right, of course, but there was the specialist people who were trained, and then there was awareness training for firefighters should you find yourself in this situation. So where are we with the awareness training for all our firefighters?
I'm not sure, that was all rolled out pre-COP26, so awareness training has been rolled out. The new SOP that relates to MTA is in place. So I'm content that that awareness training has been done across the organisation. Leslie, should anything occur, I don't. Bruce wants to come in perhaps from a training perspective in terms of how that gets maintained on an ongoing basis. But at the moment, I'm content that we have that awareness training in place.
I'm happy with that because COP26 was so recent, but thank you for reminding me. It did cover all firefighters. Okay, that's helpful. Chair, I've got a couple more questions, please. Briefly, we're moving to using the term on-call. Can I just check what on-call covers? And the last question was page 15 of 18, and that was about the incident command assessment. And there's a bit in there about it's a command competence review procedure, and it talks about extending the requirement for an ICA refresher by 2 years. Can you just talk us through this and just confirm that the People Committee have reviewed this as well, please? So what change in procedure is it, and why is it happening, and are there any impacts or risks with that? Thank you.
Okay, thanks. I'll perhaps just pick up the on-call question first and then bring Bruce in to answer the question on the IC assessment. So on-call is the nomenclature that's used across the UK in terms of RVDS firefighters, so retained and volunteer duty firefighters. So we are just aligning ourselves to that more modern nomenclature, which represents better, I think, the role of the firefighters who provide that on-call capability in the areas. So it was one of the early outcomes of the improvement project that's underway, Leslie, but it's just a name change. There's no substantial other differences to it.
So it covers reserve and volunteer, and that's
retained and volunteer, yeah.
Thank you. Retained and volunteer. Retained.
Was there anything else there, Leslie?
I think Bruce is coming back on the.
Oh, my apologies.
Yeah.
Sorry.
Thank you, Chair. Bruce Ferguson, Head of Training. So thanks for highlighting that point, Leslie. The 2-year extension can be applied when we are able to go out and assess an incident commander's competence at a live incident. So we have an operational assurance process in place already that allows us to go and do a similar check on our policies, procedures at incidents. So if a senior manager is mobilised to an incident and elects not to take charge, they can then fulfil the role of an operational assurance assessor. And now, on top of that, they can also assess the incident command competence of the incident commander, because the two processes are very, very similar. If the incident commander meets all the required standards, and those standards have been well described and are available for scrutiny, then the current 3-year time frame for a refresher can be extended to 2 years. And the purpose behind that is to acknowledge the excellent work that our incident commanders do on a day-by-day basis and give some acknowledgement towards that impact and reduce the stress that's placed upon them for coming into National Training Centre for an Incident Command Assessment, which is extremely onerous both for them and for the team. So it has been through the governance process on the people side of things, and this is now the rollout into the service delivery side of things, and all parties have been cited on it and had the opportunity to contribute and comment.
Okay, I understand it now. I just wasn't getting it. I wasn't getting it from the text, which is my problem. So basically, instead of coming in for a test one, they just get observed doing it for real.
Absolutely, yes.
Perfect. Okay, that makes huge sense. Many thanks.
Thank you.
Anything further, Leslie? Okay, excellent. Thank you. Angelina, then Tim. Angelina.
Angelina Foster, board member and member of this committee. Thank you. So firstly, just echoing the comments of colleagues around the range and the richness of this report, for which thank you, really hugely valuable read. More specifically, could I just tease out a line? It's on page 4 of the report in question, page 18 of the full pack. And it says, it's a reference to the high attrition rate within the operational control centres. And it says, work is also being carried out to address the high attrition rate. I'm raising that now, I think, for a couple of reasons. One, there's a bit of an implicit hint of potentially staff welfare issues in there that may underlie a high attrition rate. But secondly, I'm fairly sure it's not the first time I have read a line of that nature. So if you could just say a bit more, how high is high, and what is our understanding of what's causing this and what we're doing about it. But as a bit of an offshoot, could you also just clarify for me the relationship between this work in this bit of the report and the staffing solutions team activities that Ross referenced, but they come up in a separate bit of the report on page 21. It's just to understand how we're marshalling our efforts for remedial action in these broad workforce areas. Thank you.
Thanks, Angelina. And I'll again hand over to Stuart, and he might want to bring in David, who will be closer to the detail to be able to answer that. Thanks.
Yeah, thanks. I'll just highlight first that the absence in the welfare rate within OC per 1,000 staff group is the highest in the organisation, Angelina. So I think off the top of my head, it's 32 per 1,000, and the rest of the organisation I think is 7 per 1,000. So it's quite a significant difference in terms of stress referrals, etc. You know, so and there's a number of various reasons for that. The attraction and retention within OC has been challenging and is becoming more challenging, particularly in light of competing demands and a very competitive employment market where people are getting obviously better opportunities to potentially work from home and things like that as well. And the shift systems and things like that are quite set within OC, and that perhaps isn't very flexible in supporting of a family-friendly approach. So there's a number of work streams in place to try and address that. So we're exploring terms and conditions in the round in terms of OC, including what pay could be enhanced or what, you know, to make it more attractive and retain staff. There's elements around about self-rostering that I would like to explore to make it more family friendly, where the personnel could actually choose when they'd like to work as opposed to being set into rigid shift systems. And we've set up a strategic group along with the FBU to work in partnership in order to address collectively a number of these issues, because we recognise that the pressure that's on. So I'll perhaps bring David Farris in, who's obviously heads up OC from an operations perspective, in case he wants to provide any more detail and answer that question around the staff and solutions team.
Could I just quickly say something for the chair as a supplementary to Angelina's question, which might be able to be answered within that question, is when we've talked previously, Stuart, about benchmarking and about how we benchmark with other services. If you happen, and I don't expect any answers if you know, people ferreting away trying to find answers quickly now, but if you happen to have any other benchmarking comparative information around attrition rates, etc., from other services, it might be interesting to know that. But thank you. David.
Yeah, I don't have them to hand, Nick, but we could perhaps get them. But I'll bring David in first.
Sure.
Thanks, Chair. David Farris, Head of Operations. Yeah, I think Stuart's covered most of the main points in some of the work that's ongoing. We saw a huge amount of applicants to operations control at the onset of the pandemic, when furlough kicked in and other areas of employment wound down. There was a huge amount of recruitment into OC. Subsequently, we saw the loss of a number of those staff, and we have not had the same level of return. In fact, it was worryingly low in terms of applicants at the follow-up process once the job market had started to open back up again. I think Stuart's covered a number of the factors, but certainly the feedback from those early leavers, individuals who choose not to stay, and those that are leaving further on into their career, does cite some of the things around structures, around rostering, around remuneration, about the job market and the ability to command better conditions, better salaries in less stressful environments. And I think the stress and morale issues have been covered previously around about some of our presentations, and particularly around about systems. Stuart mentioned the Fire Brigades Union strategic partnership that we've set up, and FBU colleagues share similar concerns and are looking to work with us in tandem to consider solutions, and those solutions are not currently being administered through the Staff and Solutions team. There's no direct link at the moment because those solutions have been passed to the Area Commander Libby Logan within Operations Control as part of her work for the oncoming year to look at some potential enhancements with remuneration and enhanced pay for OC being high on the agenda. Thank you.
Thank you, David. Angelina, does that answer your questions fully at the moment?
It absolutely does, and I'm sure colleagues will do this anyway, but it feels like an area that this committee should keep an eye on progress with these actions. Yeah.
Yes, thank you. I think the vulnerability of the OCs in a broader sense is something that the committee is definitely keen to keep an eye on. So thanks to all. Tim.
Yes, thank you, Nick. Tim Wright, board member, a member of this committee. I'll echo something about the papers as well. As I've already said to the DEP on a different occasion, always pleased to receive papers that have gratuitous images of customised motorcycles in them. That's more the merrier, please. Thank you. But on a slightly more serious note, can I just ask, just to get a little bit more clarification around the national fire resilience element, which is begins on page 5 and continues onto page 6, talking about the majority of the assets that are coming to end of life. Can I just get a sense from you about what sort of assets we're talking about, what sort of value we are looking to place upon them, and in terms of that, the cost of replacing them, given that we have, as we know, financial constraints, but also what risk is presented to the service if we're not able to replace them in a timely way.
Thanks, Tim. Again, I'll pass over to Stuart and possibly David to give a full answer to this. Stuart?
Yeah, thanks. I'll start off and then David can come in if I don't cover all the points. So the national resilience assets, Tim, relate to the equipment that was provided under the auspices of the New Dimensions project, which was in 2007. And that is the DIM, so detection, identification and monitoring equipment. So basically CBRN equipment, the mass decontamination equipment, the USAR urban search and rescue equipment, and the high volume pumps was the main assets that were provided by the Scottish Government to the then Legacy 8 Fire and Rescue Services in Scotland. Those fire and rescue services took ownership and ongoing maintenance costs of the New Dimension assets, which was slightly different from what happened elsewhere in the UK. They were provided by the Home Office and then they were subsequently maintained and refreshed by the Home Office. So there's a slight difference. Those are all coming to end of life at the moment. And the conversations that David and I have been having with the Home Office was around about the Barnett consequentials flowing from Home Office in order to replace these assets. And in the comprehensive spending review before Christmas, it was set out that there was going to be no funding for a replacement to New Dimensions 1, named New Dimensions 2, originally enough. And so there was not going to be any Barnett consequentials coming. So the question we put to Scottish Government is, do you still want these assets to be available in Scotland for national resilience? And do you still wish interoperability with the English Fire and Rescue Services in case of a major event that happens anywhere in the UK? Because my view is these are assets that have been provided by the Scottish Government to meet a risk identified by the Scottish Government. So to answer your question on about funding, we believe over 8 years in order to replace these assets, we would need 18.8 million. And that is the business case that we've currently developed and it's going through governance at the moment. I'll probably caveat that by saying it's 18.8 million as things stand at the moment in terms of inflation costs and what we're seeing with supply chains. That could increase substantially. But as I say, we're having very positive discussions with the sponsor unit in regard to that at the moment. David, is there anything I've missed from that you want to add?
Nothing further to add.
Thanks. Tim, does that answer your question?
It does to a large extent, Stuart. I was interested that you said that it was a risk that was identified, that they were provided to address a risk identified by Scottish Government. I don't want to put you in an awkward position in a public meeting, but what's your perspective of that risk? Is it one that we should be particularly concerned about? I'm assuming by virtue of the fact that we're seeking to replace the equipment that you see it as having some important role.
Yeah, indeed. So the business cases and the new dimension assets are based on the output from the National Risk Assessment, which identifies terrorist attacks, CBRN attacks, etc., as part of that. So in order to meet that risk, we would require the resources to respond to that. However, most of those resources are not statutory for us. So there's this kind of question around about what's statutory and what's not. And that's the conversation we're having with the Scottish Government at the moment in terms of should they wish to have a response to those types of attacks or incidents, we would require the equipment to do that. So those are the discussions that are taking place, Tim.
That's very helpful, Stuart. Thank you.
Leslie.
Can I just come in the back of that and ask if that 18 million is included in our forward asset resourcing requirements? Thanks.
No, not as yet, Leslie. It sits separate with that. However, the conversation with sponsor units, they were keen to amalgamate it into a single capital request, but this sits outside that because, as I say, we believe as a service that it's not with our responsibility to replace those assets. So we're trying to keep it separate at the moment. But in terms of the information we've provided to the sponsor unit, they've put it together, to try and get that capital bid put forward at this stage.
Okay, thanks.
Thank you. I've got a couple of small points. Just these are fairly rapid fire things. From my perspective, having read this, the document conversion project talks about operational documentation to ensure it's easily understandable, consistent, and accessible to support firefighter safety at operational incidents. Does that include, is ORI within that? So the risk, the risk information when it's pushed out on mobilization to the GTAC tablets, is that what's covered and meant under operational documentation, or are you talking more about policies and procedures?
I think it's both, Nick, but I'll just bring probably David and or Mark Duffy in just to clarify that.
Yeah, I'll just come in there, Chair. It's predominantly policy and procedure. The operational risk information is under a separate app within the tablet.
Okay, thank you. Thank you. That feeds into a general theme which will become apparent, I think, through the meeting about GTAC tablets and the business about how you give firefighters that dynamic information that they require at the moment that they need it, and to make sure, and this also, it ties in so many parts. This is what I was referring to about such a fascinating suite of papers when you look at Grenfell work as well, which I don't want to preempt the agenda, but when you look at that and you see some of the points there, it just becomes clear to non-specialists, and I will make this point of view, is that getting that dynamic information quickly to firefighters at the point at which they are under a fair degree of stress and potential danger, then this ORI information and the GTAC tablets, it's really growing in my focus of what I read in between the lines about within these papers. I'll just quickly flick through. I did have one further point about conversations with ICT colleagues, but around the solutions around GTAC tablets, but we'll come on to that, I think, a bit later on. The MTA points were covered. Just bear with me. Sorry, I'm just using a slightly different way of making my notes. I think that's probably it from me. I'll just check that Paul doesn't want to ask any questions on this, but before I move on to the next agenda item.
No, thanks, Chair.
Okay, thank you. Thank you, team, for that. Excellent, and as you can see by the questions, very interesting. Can we now move to item 8, the service delivery performance reporting, and over to you, Stuart and Chris.
Thank you, Chair. So this presents the quarterly performance report for Q4 of 21 and 22. And as always, I will bring Chris in to provide the analytical package that supports this, and then I can provide any detail around about any of the specific points. So Chris, over to yourself, please.
Thanks, Stuart. Thanks, Chair. Good morning all. Chris Fitzpatrick, Business Intelligence and Data Services Manager. As per previous meetings, I'll look to cover the salient points on this year's performance and take any questions at the end along with Stuart. Just to begin, I give a brief summary of operational demand before commenting on the report itself. So in terms of overall operational demand, attendance to incidents across Scotland was 95,655, which represents a 12% increase versus 2020-21. This wasn't wholly unexpected due to the decrease in calls last year that predominantly related to the societal impacts from the pandemic. But in terms of the 3-year average, the change equates to a 1% increase based on that 3-year average, and it's the highest rate of incidents since 2010-11. The increase against last year impacted all 3 main incident categories. For fires and false alarms, it was a 10% increase, and non-fire or special service was 20%. The change in the 3-year averages shows a 3% increase in fires, 0.3% increase in false alarms, and a 5% increase in non-fire. Across the full year, the average daily rate of incidents was 262. The peak was in Q1, where the average number of daily incidents was 278, but for April alone, that was 322, with 50% of the activity recorded as fire, and more specifically 40% being outdoor fires. February has the lowest daily average of 219 incidents, where false alarms contributed to more than 60% of that figure. Fires follows the same pattern in terms of the daily demand, with April being the busiest month, accounting for 17% of the fires for the year, and February being the quietest, accounting for 4.5% of all the fires. Across the whole year, the busiest time of day for crews remains the early evening, with 40% of all fires recorded between 5 PM and 9 PM. All casualties attended by SFRS personnel increased by 16% against the previous year. But as we recorded an 18% reduction in fire-related casualties, the overall increase was driven by non-fire casualty rates increasing by 27% on the year. Both fire and non-fire casualty rates are down based on the 3-year average, 10% for fire and 6% for non-fire. Fire fatalities from accidental dwelling fires in 2021-22 were lower than the previous year and in line with the previous 3-year average. Overall, fire fatality have shown no trend in recent years. One interesting observation from this year's overall stats is that even though there's been a 5% increase on the 3-year average for non-fire calls received from Scottish Ambulance Service, there's actually been an 11% reduction in the number of casualties resulting from those incidents. This does require further analysis to understand what the general nature of those incidents has been.
Chris, could I just interrupt and just ask you to repeat that last thing you said about the Scottish Ambulance Service and the casualties?
Certainly. So we've seen a 5% increase on the 3-year average for non-fire calls received from the Scottish Ambulance Service, but we're seeing an 11% reduction in the number of casualties resulting from those incidents.
Okay, thank you.
Okay. So in terms of the report itself, the indicators with a stated objective, we see 7 of the 15 achieved the target set. This includes fires in non-domestic buildings, deliberate primary fires, home fire safety visits, fire casualties, low and medium severity accidental dwelling fires. At the time of writing the report, UFAS was less than 0.1% off target. And with potential changes to the data before the compilation of end-of-year statistics, it's appropriate to recognise that performance as amber. 5 indicators are shown in red, which includes accidental dwelling fire fatalities. This is unlikely to change with regards to its RAG status. The others were for home fire safety visits to high risk rated groups. This in part is affected by the service's ability, or was affected by the service's ability, to reach members of the public during 2020-21 and into the beginning of the past year. Retained duty system availability fell below 80% across the year and has been continuously affected by COVID-related absence. We're also aware of an issue within the Garton system where availability at station level isn't being captured correctly and causing a slight impact on our aggregated performance. We don't believe the issue to be extensive, but there is the possibility that that figure reported is likely to increase. So better availability effectively. Hold time availability was 1% below confidence level and similarly affected by COVID. And then finally, refuse and vehicle fires, which was 12% off the target set. If we consider the historical change since 2010-11, we know that when the targets would have been reviewed, there had been a consistently high rate of reduction taking place. However, it may have been overly ambitious to believe that the rate of reduction of 10% could carry on indefinitely, and a more variable rate of change in the last few years should be taken into account for the next iteration of the performance management framework. In terms of some of the other indicators that we're required to monitor, we're seeing that road traffic collisions rose by 35% versus the previous year, but still tracked more than 9% less than the previous 3-year average. With the exception of last year, this is the lowest number of RTCs attended since 2010-11. Incidents attended at the request of other agencies has increased on previous years, and following the reduction last year, it's back on the same upward trajectory evident before the pandemic. This is also applies to incidents recorded as effects in entry-exit. There's a couple of points that I believe were flagged by SMB, and I'll take the opportunity just to clarify. On the first page of the report, page 35 in your papers, 4th paragraph, we specified telephone calls from other emergency services. This was only intended to identify the call origin to operations control from which an incident is then created, and not meant to have caused any confusion. On page 5 of the report, which will be page 39 of your papers, far right chart for inspections carried out in line with operational intelligence framework. It includes a percentage symbol in the header, but the figures reported are representative of the actual inspections fully completed. We will amend the header for future reporting to remove the percentage, and we'll clarify with colleagues in OI what the intended KPI should be for reporting in the next PMF. And that is the summary. I'm happy to take any questions if there are any.
Thank you, Chris. As ever, an interesting view that you give us as you review this document. It's just interesting. We've mentioned this before, haven't we, about the impact of the previous few years, the COVID, the pandemic. How do you disaggregate that effect, and then really it calls into question, doesn't it, a lot of thought around how you compare years now, and how you compare years which have been so significantly different, and probably once in a lifetime type of difference, hopefully. However, on that note, does anybody have any questions, please? Leslie.
Sorry, yeah, okay, thanks. Does Paul went in first, Nick, or just? You're on mute there.
I was just deferring to you, Leslie, but I'll go as I've now switched my mic on. First of all, I just wanted to praise you for the quality of this reporting. This is, I haven't studied it before this meeting, and I really think this is an excellent dashboard snapshot. I think it's incredibly detailed. So that was the first point. My second point was if I'm reading this correctly, the number of home fire safety visits to vulnerable groups is not being achieved on target. Is that right, or am I misreading it?
No, you're correct. And again,
is there a reason for that? That's what I wanted to explore.
Yeah, so page 3 of the report, page 37 of your papers, you'll see the 5-year history. The target for the high risk or the vulnerable groups is to increase the visits based on the moving 3-year average. So obviously we can see 2020-21 where the visits dropped down to 10,000. Now that figure will be taken into account for the current 3-year and the previous 3-year. But looking at this last year, the figure of 22,587 is marginally below the 3 years prior to. So I think it's, and again, Stuart may want to comment on this, but we did still have an impact in the first quarter of the last year, which will have had an impact on the overall figure for that year. So the service is still finding its feet and getting back up to pre-pandemic capabilities. Stuart, would you agree?
Absolutely would agree, and we also got impacted by the kind of Omicron variant over the Christmas and quarter 4 of this year as well, which obviously put us back slightly because we couldn't deliver home fire safety visits to the extent that we would like to have. But without preempting the discussion that will take place in August at the next Service Delivery Committee, I think that whole point around about vulnerable groups is a really interesting one. And to reference the next point around about what we've learnt over COVID, the team at the moment are currently analysing what we've learnt over COVID in terms of, in a very simplistic way, does the number of home fire safety visits correlate directly to a reduction in casualties and fatalities? I would suggest not. And I think there needs to be more work done around about how we can be very, very surgically targeted to vulnerable groups in terms of home fire safety visits. So a product will come forward to the next committee that sets that out, and running alongside that is a review being carried out by P&P in terms of the delivery of home fire safety visits. And really what I would like to get to with that is that we solely rely on partnership referrals, so those referrals generated by primarily health and social care colleagues, and the use or the early use of the CRIM model that we know can give us some very targeted demographic data in terms of the most vulnerable. So we'll take ownership of targeting people as opposed to waiting for people to contact us, because we spend a lot of time, energy and resource into doing home fire safety visits for what we can sometimes call as a worried well. And I think we need to move on from where we've done that in terms of that universal delivery of the home fire safety visit product, you know. So sorry if that digresses slightly, Nick, but I thought it was important to highlight that.
No, it is. Back very briefly, Nick. I agree with the targeting, and my background to my question, I suppose, is a desire to see the concentration on the vulnerable, and if you've got a way of identifying the problem, that's good. Yeah. One last thought, if I might. The value of a 3-year average, I think, is being put into doubt now, and you might wish to talk to statisticians, which I'm not, as to how you create a meaningful annual average, which somehow excludes quarters, and it won't be a whole year, which have been knocked sideways by COVID. But that's just a passing thought.
And if I could just add to that a little bit, colleagues, for those who may not just be aware, that we are looking to have a deep dive into the home fire safety visits at the next meeting. So I'm very much looking forward to that. A couple of additional smaller points. Paul, interesting that you pick up on the applicability of the home fire safety visits to vulnerable groups, because that's something we've talked before. Leslie in particular has talked about cost benefit analysis of that, and what benefits are we getting from that. So that's all hopefully going to be part of that. Stuart, and I'd be interested, you don't need to answer this now, but I'd be interested to see, just picking up on Paul's point around the target and the 3-year average, whether or not a more specific target might, but once we've done the deep dive, is that a point at which perhaps we should be reviewing the actual target and saying whether or not any form of average increase over a period previously is an appropriate type of target to have for this, or whether or not we should be more specific and more detailed in our focusing and targets?
Yeah, I think
it's just a thought.
Yes, absolutely. I totally agree. I actually think we need to move beyond a very simplistic quantitative view in terms of number of visits and focus more on the outcomes of those visits, because I think the panacea for me is creating that toolbox that gives local areas and local officers accountability and empowerment to deliver the home fire safety visit programme to meet local needs, to support the local outcome improvement plan, and as I say, to improve outcomes at a local level, as opposed to an arbitrary just increase the number of visits that you've done in comparison to a 3-year average of last year. I think that's where we need to get to, and I think that covers off a number of agendas in terms of how we use data, how we target, how we empower our staff locally and things like that as well. So that's kind of like where I'd like to get to, Nick, in a very quick time, and move away from that, as I say, quantitative kind of 3-year average process.
Fantastic, yes. And just before I bring Chris in, and just to reiterate a point I think I made it last time, it struck me last time when I read this, and does again now, that the vulnerable groups home fire safety visits is almost an enabler for a number of other performance indicators. And if we can nail that, we've almost gone to the very root of the of a lot of other indicators.
Yeah,
Chris.
and it's the same sorry to labour the point, but it's obviously the same target demographic as a number of our partners are also focusing on as well. So we can start to evidence how we support broader outcomes, not just traditional fire service outcomes as well. And I don't think we particularly do that well at the moment, albeit we do a huge amount of work in terms of that agenda, but I think we need to capture it better through performance measures.
Yeah, very much looking forward to the next conversation about this. Chris.
Thanks, Chair. It's really just to say, we do have regular conversation with other public sector partners, and there is no real general consensus in terms of a standard way to approach setting targets, particularly following 2020-21 period. But it's interesting to comment around the averages. I mean, there's still a feeling from the analysts that we're engaged with that multi-year averages should be something that we look at, but also recognising KPIs need to be addressed on a case-by-case basis. So we also have engagement currently with the Office of the Chief Statistician, and we're seeking support from the government statistical services to try and ensure that we determine the best way for measuring those KPIs. And with the PMF being looked at later on this year, it will give us the opportunity to speak to colleagues across the service and make sure that we do find an appropriate means of measuring performance for all of those key performance indicators.
Excellent.
Thanks, Chair.
Thanks. And I've just got two very closing comments, really, because I'm just aware of the time now. Your earlier comment about apologies, Leslie. Do you want to come in on that last point?
I want to come in on that last point, but I've got a couple of other questions.
My apologies. Do carry
on. Okay, nodding my head at most of the last 5 minutes of discussion on targets. The 3-year average is useful for analysis. We need to think about which outputs and outcomes we want to change, and for those we need to think about the targets. So, for example, Chris, you said refuse and vehicle fires, we might want to amend the target because clearly we're not going to make it. And I kind of think, well, we either change the target or we change the activity so that we do make the target. So I would argue strongly that we take a bespoke approach to setting targets for each of our PIs and say which ones do we really want to change and set targets that we then work towards, and which ones are we actually okay with the performance on, in which case a target based on the 3-year moving average is probably fine. That's the first point. I was going to ask if in these reports, and thanks to Paul for reminding us just how good they are, could we get the percentage of home fire safety visits targeted, the percentage of all home fire safety visits targeted on vulnerable? Can we just get that in the report? Because it has improved. We've been running at 40%, I think, and now it's 50%, which is great to see, but perhaps we could get that percentage there. But we'll look at that in a deep dive next month. I'm aware of that, Nick. Also, as part of the home fire safety visits, I have on the register of interests my membership of a number of the Wheatley organisations, so that's open and transparent. As part of one of those board reportings, there was an analysis of the impact of the fire safety partnership that we have with Wheatley, and their targeting of home fire safety visits, it appears to link to a really pretty substantial drop in accidental dwelling fires. And I wonder whether we could pick up the Wheatley experience and the extent to which it's worked and the extent to which we can perhaps take a similar or tweaked approach with other organisations. Can we pick that up in the spotlight on home fire safety visits that we get at the next meeting? Would that be okay?
Probably,
probably,
Leslie, yes. I think I'd like to just further understand exactly the detail of what it is you just mentioned. But yes, in principle, yes.
Okay, and I'm happy to, I'll email you further about that. The one other point, the call handling and response times seem to have stabilised, which is really welcome, and particularly in North, because there was a kind of steady increase in North. Now, in the minutes of the last meeting, and para 811, apologies, Nick, I could have mentioned this when we were considering the minutes, but in the minutes it said that there was investigation and that would be reported back, and that's something that has been mentioned on 2 or 3 occasions. Is there further investigation in what's been happening with the increase in response times, or is there not? And are we going to get a report on that or not? But that's against the context of, I see in this report that the response times appear to have stabilised. Thanks.
I guess the question that I'll come back to you there, Leslie, excuse me, is that we have a fairly packed agenda for the service delivery committees, and I guess as chair, I work in tandem with Ross and Stuart, just trying to figure out what the space available is and what do we really want to be looking at. If that's something that is causing you anxiety, then I will take that into account and we can have a look at that. If not, I'm content just to monitor that situation at the moment. I've deliberately not gone there because actually it is quite a bit of work, and it opens up, sometimes can open up a bag of worms when we start to look at that, how it's viewed from elsewhere as the committee is looking at that. What's your thoughts on that, please?
Thanks, Nick. I just want to clarify it, and I'm happy to close it off. The minute says increase in call handling times and response times, further investigation to be undertaken to understand the reasons behind the increase. We've touched on that a number of times over the last 12, probably 18 months, actually. So I'm in the context of the call handling times and response times now stabilising, and in context of the general explanations we've had before, I would argue that we don't need to see that information coming back, and I'm happy to get it closed off. But just in the minute from the last meeting, it was left as an action. So that's my point of view.
I don't know if it was an action for the committee or whether or not it was a note of action that was going on elsewhere. I'll tell you what, I think a nice compromise might be that if we cover it off in the service delivery update report, and we can then ask any further questions if that's necessary. Okay, that's great. So let's just take an action, please, team, that we will just make a note to remind ourselves to cover that off in the next service delivery update report. Thanks, Leslie. And your points are welcome, by the way. I really do appreciate that challenge. So thank you. I just close again, just conscious of the time. Chris, you mentioned earlier, Scottish Ambulance Service requests for assistance gone up, casualty rates gone down. It's just a thought I have. I wonder whether that's a reflection of the pressure the team are under in terms of demand, and therefore coming to a trusted colleague to assist them actually. And as it turns out, that pressure is trying to do the best for the Scottish public, but also to reduce those big blocks of red calls and other calls that are on the Scottish Ambulance Service tasking pages. Stuart, go ahead. I wasn't necessarily looking for a comment there, but go ahead.
Okay, but just to clarify, that is indeed the case. Nick, and I meet regularly with both my counterparts in police and ambulance to discuss support to other agents' calls and effecting entry calls as well and stuff like that. So that is reflective of what you've just described.
Marvellous, thank you. And Chris, I just really want to reinforce that you should be pleased to hear that I didn't pay Paul to make those comments about the report. You know what I think, and you know what the team think. There's a new member come in and was very impressed. So thanks, a great deal of kudos to you and the team for doing that. So thanks very much.
Very grateful, thank you.
And I think we'll draw a line underneath all that. That was a very valuable discussion. Thank you all very much. Can I just take a chair's liberty? And I'm just going to go for a comfort break for 2 minutes. So if anybody else wants to do the same, please feel free. See you back in 2 or 3 minutes. Thanks very much. Okay, I think we will now continue. Thank you. And we'll now go to item 8.2, the Independent Audit Inspection Action Plan update, and over to Richard.
Good morning. Thank you, Chair. Yes, Richard Wetton, Head of Governance, Strategy and Performance. And can I just also add my thanks to members for your comments about the quality of the papers this morning, particularly on the performance papers. I know that'll be greatly welcomed by the team. Thank you very much for that. Also appreciate and the next set of papers here around the independent audit and inspection, lots and lots of information. So again, Chair, I'll try and take you through this succinctly, and as always, go through them one at a time. So colleagues will see that there are a number of inspection action plans for discussion. You'll note that we have the high-level dashboard, which gives you an overview of those. And I'll go through those, and also note that we have a closing position statement also in relation to the fleet and equipment plan. So first one up, Chair, is the operational risk information. So this one, progress has been limited in terms of the outstanding recommendations. One remains green on target, whereas the others are red due to slip in timescales, which we've discussed before. So that means the overall RAG status we've applied to this is red because of this, because of these timescales. Now, there is a degree of interdependency here in terms of ESMCP, which we've discussed before and members will be aware of. And you'll also note that at the latest update that we've received, relating particularly to in-vehicle systems and tablets, there is progress on those. But in terms of overall completion, still we don't know when that is, although there's some dates given there in terms of design and estimation for completion of that piece of the work around July. Chair, you'll also note that there is a proposed revised due date for action 4.1 in relation to the tablets. You'll also note that functionality remains a concern in terms of the update that we've received, but an update provided by ICT colleagues is aiming for November 2022. So I shall pause there and take questions if I can. What I should say, colleagues, is David and I have had a discussion, so if there's any detail on that, we'll try and get to it as best we can. Thank you, Chair.
Thank you, Richard. I appreciate you just taking us through that, because there is a lot within this item on the agenda. Colleagues, something I think is worth us just putting in the back of our minds now is I'm going to suggest, as we get towards the end of the meeting, that we have the next risk spotlight on the GTAC tablets, because I feel that the GTAC tablets seem to be coming in to focus and feature more and more on many aspects, including safety aspects and what I would sort of describe as mission critical aspects, and GTAC and ICT, etc. So so if that helps as we go through our discussion at the next meeting, we'll look to have a risk spotlight on the GTAC tablets. And this particular ORI action plan prompted that comment. I'll noted Robert and then Tim. Just give me 2 seconds while I just. Yeah, okay, so that was my point to make there. I'll just open up the floor. I'll go to Robert first. Robert.
Thanks, Chair. Robert Scott, Chief Inspector at the Fire Service Inspectorate. I think this is a recurring theme for us and quite frustrating, and it must be frustrating for the service that it appears in many of our thematic inspection reports, because it is something that comes up every time we visit fire stations and every time we speak with frontline staff, particularly around the GTAC tablet. And it's very easy to be critical, and it's very easy to focus only on the negatives. And what I say, and I've said many times at this committee before, is if we only focused on the reds, then it would be a very negative meeting indeed. But look at all of the grey boxes that have been completed, and look at the amount of work that has gone into satisfying these recommendations and making improvements. And I think it's important that we do take a moment to do that in all of these reports. But the GTAC tablet, unfortunately, is a recurring theme, and I welcome your approach, Chair, to having a spotlight on it. Rather than being a risk, though, I think it's more of a missed opportunity. I think the information that could be made available to frontline firefighters and could be pushed to fire appliances without them having to go in and interrogate the tablet and search for it proactively, whilst they've got a number of other things on their minds on the way to an incident, would certainly make life a bit easier and would certainly reduce risk. But I think it's a missed opportunity more than it is something that causes me any major concern in terms of risk. I've been recently down to London as part of our high-rise inspection thematic, and observed the London Fire Brigade's use of their tablets, and it might be worth just dipping in with colleagues to have a look at how they use their tablets. It seems that they are a wee bit more proactive, particularly in use of the high-rise information that is available to their firefighters, and it is almost the first thing they grab when they jump onto the appliance is that tablet, so they can understand what they're going to, what equipment they'll need, what risks they're facing, and it's all made available to them on the tablet. And I'm not so certain that that's the case in Scottish Fire and Rescue at the moment, and in fact it will be another observation within the high-rise thematic when that is published. And I feel bad for continually revisiting the same thing, but it is an issue that is always brought to our attention regardless what it is we're doing, whether it's local inspections or thematics of particular areas of business. So just an early heads up on that. I think it's important that we try and resolve this. I welcome the progress that's been made to date, and I welcome you Chair, as the Chair of this committee, focusing on the GTAC tablet at a future meeting.
Great, Robert, thank you. Your input is valued, and I wonder whether or not the services team could just, well, I'll leave it how the service want to do this, but perhaps they may wish to consider just having a word with you to bring that element that you've just spoken to into the briefing around GTAC tablets for the next meeting. Stuart, do you want to answer particularly on that? I presume you do.
Yeah, it's probably worthwhile. I think Tim's maybe going to come in on the same point. If Tim wants to perhaps make his point first, then I can respond.
Okay, all right, Tim, go ahead.
Yes, thanks. I was going to talk about the GTAC thing anyway, had it not come up and become front and center. And it's very interesting what Robert was saying. I've just spent some time down in London over the weekend, and there was considerable coverage of London Fire Brigade's response to Grenfell and the deployment of drones and smoke hoods, and the tablets were featured quite heavily, and I was quite impressed by it, although you have to take these things with a large pinch of salt in the way that they're presented, but I was rather impressed with some of the things that they were demonstrating on these tablets, and I would have brought that into the conversation. So it's very interesting, Robert, that you have that kind of proper experience of it rather than mine mediated through the TV. However, I don't want to get into the weeds of the GTAC. I just ask that if we're going to do that at a further thing, can I ask that one thing is thought about, and that is, have we considered the use of external expertise? Because this was going to be my question on extending the timeline for internal ICT to deliver. I was going to ask the rhetorical question, have we considered bringing in external expertise to resolve this quickly? So if we're going to look at this, the missed opportunities, as well as just the kind of tactical issues of resolving this outstanding issue, it might be helpful to look at this as whether we should be bringing in external expertise, because it seems to me it speaks to an ongoing challenge that we have in a lot of the technical projects. We are constrained by our ability to deliver against these things by the use of external resource, and I wonder if there is an opportunity to draw in external resources to help us move ahead more quickly. With that, I will shut up.
Your broader points noted there, Tim, about external expertise and then specifically towards the GTEC tablet. Stuart.
Yeah, thanks. I'll just perhaps to speak to that last point that Tim made. You know, we've asked similar questions of our colleagues within ICT. That particular question around about is our scope to bring external support in to develop the GTAC tablets. So it's one of the biggest frustrations that currently sits within service delivery, and not just from an operational perspective, but the GTAC tablets are also central to the work we're doing around about hydrant locations, the Safe and Well project, you know, being able to automate Safe and Well visits as opposed to having screeds of paper that people need to fill in and double entries and all that kind of stuff, you know. So we are pressing very heavily on ICT colleagues to progress with this. And I suggest that when the paper comes forward in the next meeting, it's a joint endeavour between service delivery and ICT colleagues to give you that kind of rounded kind of view on where we are with it. The slight complication with it is that the ESMCP project is beginning to gather momentum, and there's an opportunity for the service to be a pathfinder as part of that, and to all intents and purposes network every one of our appliances through the early installation of the ESMCP equipment into the appliances, and doing so would, one, deal with this information around pushing data to appliances, but it would also get us well ahead of the curve in terms of fitting out appliances in preparation for the full rollout of ESMCP. So the two elements to ESMCP are data and the voice part. The voice part will come later with the full project, but we're hoping to get ahead with the data project. So ICT are working on those two strands simultaneously to try and align them. And if they do so, that is absolutely panacea, because we'll have every appliance, as I say, essentially a driving hotspot that can push out information, it can send information, and it meets a number of our agendas. So it's vastly complex and way beyond my technical expertise, but I would really welcome that opportunity to speak to the committee and forthcoming along with ICT colleagues to set out a clear timeline in terms of how we're going to get to where we want to get to in terms of the GTAC tablets, because the work that David and his team are doing in terms of operational document reviews and making everything absolutely intuitive, and you know, you're 3 clicks away from every piece of information you could ever need, is brilliant, but it's moving quicker than the infrastructure. So we need to try and align those two things, you know. So it's probably an opportune moment for David and the team to present the ops document review stuff as well as the technical solution that will support that. So David can come in if there's anything I've missed from that, but I see Leslie's got a hand up.
I'll just come in here a minute, because I don't want to preempt too much discussion now for the GTAC tablet conversation next time. And what you say is absolutely fantastic. Can we just have in the back of the mind what we're dealing with is the action plan now for ORI, and we're in danger of going down a big deep rabbit hole, which is fantastically interesting and in fact leads to many warrants. But I particularly support your view about having ICT colleagues along as well. Thank you. Yes, and hopefully by doing so, we then bring the visibility of this even higher amongst the board members as well. So, Leslie, with all that in mind, do you still want to make a point about this? Go ahead.
Okay, not necessarily expecting an answer to this question, but do SLT have an agreed shared view of ICT priorities, and are ICT delivering to those priorities? If ICT don't have the capacity to deliver on those priorities on the timescales SLT feel to be right, does that take us to Tim's point about external resourcing of some things? It's a point I don't necessarily require any form of response, Nick.
Yeah, thanks. I think that's probably a question in a lot of our minds at the moment. I don't necessarily think its place is necessarily sitting on an agenda item to do with the ORI information here. But Leslie, absolutely, clock your point, and I know what Tim's response will be to that as well, and support to that. I think that's possibly something that we could bring up either at strategy or sort of board, probably strategy, and hopefully Kirsty has clocked that as well. So if that's sufficient answer at that point, then that's great. Okay. Do colleagues have anything further to add about this first action plan, ORI? No. Thank you, Richard.
Thank you, Chair. Thank you, members, for the discussion. The next one, Chair, is the Planning and Preparedness for COVID-19 update. Members will recall this was based on a light touch review carried out by the Inspectorate's team. To date, 9 actions have been completed, 2 within the reporting period. The remain, we're content that they're progressing steadily. I should draw your attention to 3.3.4 and 3.3.13, where we're seeing a slip in time. Both of these are related to the production of a report linked to our COVID activity, part of our review of COVID. And I can assure the committee that that report is in draft. I've seen it. So we're expecting it fairly soon. The update given to us by P&B colleagues is July this year. So the overall RAG rating for this is green, and the estimated completion around 90%. Thank you, Chair.
Thank you. I don't have any questions about this. Do colleagues have any questions? Nope, lots of shaking of the head. Thank you, Richard.
Thank you, Chair. Next one is related to command and control, and this goes back to a report published in August 2020. Overall RAG rating for this is now moved to green and is noted as 100% complete. We saw this at a recent SMB meeting chaired by the Deputy Chief Officer, where we go through these things, and we'll be expecting a formal completion report for this at the next period. Again,
noted. Thank you. I don't have any further comments. Not expecting colleagues to say that much about that. No. Okay. Thank you. Fire Safety Enforcement Action Plan.
Thank you, Chair. Let me just move my papers around. Lots of them. There we go. So in terms of this one, we over the last period, the Fire Safety Enforcement Action Plan, one of the remaining actions has been completed, and that was the one, if you recall, we were just awaiting the legal team to review the procedure. That's now been completed, and we have 2 deferred actions. Again, these have been discussed here previously, both relating to activity around the NFCC. What we're proposing, or what's being proposed to us, is that in terms of the specifics on our action plan, that we now look to merge these because they're so related, and we're just awaiting for that progress. However, as you'll see from the update, progress has been reported, so we're now seeing these things moving, whereas previously we'd not. Overall, the RAG status for this is red, just because we apply that to a slip in timescales, and the overall action plan completion estimated around 90%. Thank you, Chair.
Okay, thank you. Paul, go ahead.
As I understand this, we're waiting on a joint working party from the NFCC. That sounds to be sensible. My concern, I suppose, is I don't have any idea of whether this is going to last for 2 years or 5 years, and I don't see a timescale here. If this is genuinely being taken, if you like, to be a wider solution rather than just a Scottish solution, maybe we should actually be marking this as solved as far as we're concerned and keeping some different form. But clearly we need to know the time, and this is no longer really probably the appropriate place to do it. That was my thinking.
That's interesting, Paul. I thought you were going to reflect exactly, almost word for word, my question, but mine diverted quite significantly right at the very end when I was going to ask about. So carrying on with what you said, but also, can somebody simplify the roles and responsibilities between the NFCC and what is a statutory duty for the Scottish Fire and Rescue Service. And therefore, if something with the NFCC does take a long time, where do we sit as the Fire and Rescue Service in Scotland under legal responsibility to fulfill an obligation? Stuart.
Thanks. And the exact point that Paul raised was going to be a point I was going to make. At my last continuous improvement forum, there was quite a level of discussion around about these two outstanding recommendations, and I was going to have a further discussion with HMI to say, you know, if it is within the responsibility of another organisation out with the control of SFRS, you know, can we start to explore, as Paul rightly said, removing them or marking them as complete, subject to the other pieces of work taking place, you know, because if not, this action plan could sit open for a number of years, and it is already a number of years old. So I was going to make that exact same point with Paul and pick up a conversation with Robert on that. So I'll pause before I pick up your point, Nick.
Robert, come in on that point if that's what that's about, and then we'll come back to the point I made around Scottish specific action.
I think it's an interesting point, and it's one that I'm happy to pick up with Stuart off table. As you know, the board and the service has to have regard to our recommendations. If your action in regard to that is that it's out with your hands and it's the NFCC that are holding this up, and you deem that your action is therefore to await the outcomes of another party's work, then that's your action. You know, as long as you detail that, as long as you record that and you monitor that progress and revisit it at a point in the future, then there wouldn't be anything that we would wish to add to that. I don't think, you know, obviously the onus lies on you to have regard, and that's where it becomes a little bit grey, isn't it? How you've had regard and how you've actioned it is a matter for the service and not for us to detail on your behalf. But I'm happy to have more discussion about it with Stuart, because it is an interesting point.
Yeah, no, point well made, Robert, about that aspect. Stuart, could I just cue you back in now to the point at which we have perhaps a legal responsibility for that? And yet we'd like to comply with the NFCC guidance, etc. Any thoughts on that? Yeah,
I'm perhaps getting to the limit of my competence in terms of certain elements of this, and we maybe need to bring Chris or the team in to detail it. But my understanding is the original approach to fire safety and the categorisation, etc., was done at a UK level because it was based on the FSET programme, and I'm assured because Paul still has nodding. So it was based around about that, and that's what we based that. So it's a UK approach to fire safety. Whilst there's legislative differences between Scotland and UK, it doesn't apply to the kind of overarching process to manage it. I've probably put that across terribly, but if we need a further input on it, I'm happy to bring Chris or the team along to detail that.
I'm content, as the originator of that question, I'm content with that. That's fine, thank you. Do colleagues have anything further to add on that? No. So the request, let me just scroll back up there, or perhaps Richard, you could jump in. There was a request of the committee there to what?
So we're just I suppose it's back to the point Stuart said about discussing internally at the next improvement meeting, which is around merging those particular elements into one, because effectively it's related to the same issue of the NSCC or the national standards. And to note the RAG rating, etc.
Yeah. Yes. All noted. Thank you.
Yeah. Thank you, Chair.
Let's leave it like that.
Okay. Next one, Chair, members, is the local inspections national recommendation plan. And just for clarity for Paul as a new member, Paul, in terms of the local inspections, what we do is in terms of the recommendations, some are purely local and they will remain within the purview of the local senior officer, and they will have their own plan for delivery. And you can see that in terms of the Midlothian local area inspection. Any of those inspections that have a national implication, we pull out. And this is what we have here in terms of the national recommendations. So the only one remaining that we have is related to the Midlothian local area inspection. And you'll see that that's related to incident ground radio capability replacements. This project is part of the ICT work plan for this year, and a revised timescale given to us for the end of the financial year, or March 2023. So that applies to both the national plan and the Midlothian local area inspection in terms of the only outstanding action. So RAG rating has changed from green to red because of the new revised timescale going beyond the original intended dates. But overall, 90% complete on the national recommendations, and for the Midlothian plan, 85% complete, given one action remains. Thank you, Chair.
As far as I'm concerned, it's noted. Thank you. Does anybody else have any comments? Noted. Noted.
Thank you. Last one, colleagues. Thank you for your patience. This is really the final piece of the Fleet and Equipment Action Plan. So this piece of work's been completed. The action plan has been completed. What members have is a closing statement. So this is something that we introduced in 2020, I believe. So this is a year after the start of this action plan, which is why we haven't got any opening statements in this. The newer ones obviously have opening statements. But the intention of this in terms of a closing statement is just to try and, for those involved, to give a statement about what difference it made in terms of implementing those inspection recommendations for yourselves and for the inspector and his team. So I'll just put that there for noting members to see. Thank you, Chair.
No, it was an extensive read, Richard. I did actually go through the whole thing, and I was marveling at the size of such a closing report and the work that's undertaken to achieve that. So very much picking up on Robert's point really about celebrating what has been done. There's an awful lot of work gone into that. So thank you very much indeed. Robert.
Thanks, Chair. No, it's really pleasing to see this report closing. It's obviously been on the stocks for a while. It was quite a large and complicated report with 32 recommendations within it. And one of the first actions I took on when I took up the post of Chief Inspector was to revisit this particular report and to have a meeting with some of the responsible persons from Fleet and Equipment to understand the position this far. I was at that point content that we didn't need to do any more work on this, that progress had been made and that it was on a trajectory to complete. And at that point, I would have been happy to sign it off right from day one of taking up this post. And I think it is just worthy again, and I don't want to labour the point, but just so encouraging to see the amount of progress that's been made, and speaking to those individuals from Fleet and workshops and equipment, understanding that they actually felt there was a benefit to this, that value had been added from going through this process, and that they had saw improvement. And that actually makes it all the more meaningful for us as an inspectorate to get that feedback and to understand that our recommendations turned into actions equal improvement. And that's why we're in the jobs that we're in. So really encouraged to see it conclude, and really encouraged by the benefit that it's added. So just thanks to all concerned.
You're on mute, Chair.
Thank you, Robert. I echo those thoughts, and I also just remember the slightly emotional meeting that occurred when it was first presented. But thank you, and great piece of work. And I think that concludes 8.2, Richard, if I'm correct.
Yes, thank you, Chair. That concludes our report for this quarter, and evidence of our due regard for the Inspectorate's recommendations.
Thank you. Excellent. Stuart, 8.3, UFAS preparing for implementation workgroup.
Thank you, Chair, and I'll be brief in terms of this update. So the paper provides progress report of the ongoing UFAS project. As I set out the last time, there are 6 established work streams to support the implementation of the selected option made by the board in December. And the primary focus over this period has been in relation to the comms and engagement work stream, and that is to ensure that duty holders are adequately prepared for the future changes and indeed have time to support and review fire risk assessments and management processes. Paper sets out in section 3.3 some of the mechanisms that are being developed in order to support the comms and engagement. Another key area for focus remains around about the engagement with alarm receiving centres or ARCs and putting in place operational arrangements with those ARCs. You'll see in section 3.4 that following legal advice, we've chosen not to develop separate MOUs with each ARC, and that is not dissimilar to what other UK Fire and Rescue Services have done. We're continuing to develop key performance indicators with our colleagues in Performance Data Services in order to ensure that we can adequately report and evaluate the impacts of the changes when they go live. And lastly, I'll need to highlight the fact in section 3.7 that there's a real close interdependency with CCF, but also to provide assurance that the UFAS project team and the CCF team are working very closely on that matter. So I'll pause here, Chair, and just ask that the Service Delivery Committee note the update of the UFAS project.
Thank you, Stuart. Let me just open that up to comments. I have one quick question. Okay, nobody at the moment. Could you just give me a couple of words about the interdependency between CCMS and UFAS, and looking at a worst case scenario with CCMS, where does that leave us with the implementation of UFAS, given the current forecasted environment with saving money and all the things that were some of the benefits realization around UFAS?
Yeah, I guess the easiest way to answer that question, the current command and control systems are so antiquated and so fragile that we can't make changes to the back of them in order to support what we'd like to do with the UFAS response. It would have to be very manual, and reflecting the conversation that we had at the outset around about the pressures on OC, that's the last thing that I want to introduce at this stage, is any kind of manual interventions that need to be done. So in order to progress with the UFAS rollout, we would need to have the new system in place. And I'm not completely aware of the timelines at the moment, but as I say, that work's getting done at the moment to try and make sure the timelines are assessed alongside each other. If not, we'll have to have a discussion around about the implementation date of UFAS, but that'll be dependent on what the CCF timeline looks like.
I don't quite know what to say to that, but yeah, okay, thank you, Stuart. I'll just note that comment. Thank you. Colleagues, if you've no further thing to add, we will note that 8.3 and the work plan update. Thank you, Stuart. We are running a little behind at the moment, and this brings us into the operational learning and the clinical governance framework, and over to Bruce.
Thank you very much, Chair. Bruce Faxon, Head of Training. The report's there, I'm sure you've read it. I won't dwell on it for too long. I'll just draw your attention to a couple of key points. All aspects of the partnership between SFRS and our colleagues in the ambulance service are nearing completion. The MOU was signed recently by the Deputy Chief Officer, and responsibility for all aspects of clinical governance has been shared now by our operations and training functions as they cut across the remit of both teams. We've got all meeting and governance arrangements in place, and the technical working group has already met and generated a half dozen objectives for this financial year. We're now moving this across into our business as usual, because we are of the view that all of the significant pieces of work to embed clinical governance within the organisation have been completed, and it's the correct time to move it across into that business as usual stance. I'm happy to take any questions or observations on the paper, Chair.
Thank you, Bruce. A very succinct and focused overview of that report. Thank you. First of all, do colleagues have anything? Because I have just a couple of points to make. No, okay. Has the service level agreement been finished? Been signed off and finished?
It's been drafted by our legal team and is currently sitting with the ambulance service legal team. We do see this pretty much as a formality, but it is sitting at that final stage. So it hasn't been entirely completed, Chair, no, but it's at that final stage.
Right. I think what I'd like to do, and I'm happy to take an action on this, is pick this up once the Director of Training, Safety and Assurance is fully in post, and just have a bit of a sort of a stock take of a conversation with him about that, and then see where that takes us in terms of the role of this committee within that process goes forwards. Because there have been conversations in the past about perhaps an annual report coming to this committee, etc. But let's, if nobody else has got any further comments, thank you very much, Bruce, and thanks for representing the directors on that. And I don't have any further questions.
Thanks very much, Chair. Thank you.
Stuart, back to you for the Grenfell Tower final report.
Thank you, Chair. So this presents the committee with the final report relating to phase 1 recommendations from the Grenfell inquiry. I'll perhaps start by highlighting the significant amount of work that's been carried out since the tragic event which took place in London in 2017. That not only includes the action plan that we're referring to here, but the wider work that was done under the auspices of the Ministerial Working Group and the 3 subgroups that sat beneath those being the Fire Safety Regulatory Framework, which was led by Scottish Government, the Building Standards work, which was led by Paul Stollard, and Enforcement and Compliance work, which was led by John Cole. A number of significant sector and built environment improvements have arisen as a result of those specific working groups, and SFRS were represented within each group. This specific action plan sits alongside that work and was a direct outcome of phase 1 of the public inquiry, and the plan was first presented to the Service Delivery Committee back at the start of 2020, and progress updates have been provided over that intervening time. Clearly there has been quite a significant impact by COVID, which we've obviously flagged on a number of occasions through the committee. The agreed plan contains 44 recommendations, which are a combination of recommendations which were made to London Fire Brigade and indeed the wider UK fire sector. I'm mindful that we've got a presentation later on the agenda which will provide a lot more detail in terms of some of the improvements that have been made as a result of this action plan. However, the highlights of those are set out within section 3.10 of the paper. I can confirm that the 44 actions resulting from phase 1 report have either been processed or closed, or one action has been moved to another action plan, and that's the one action that relates to the CCF project. The attached appendix shows the initial position, SFRS position against each recommendation, and along with the evidence to support how we have met each action is also provided. I'd again highlight there are some regulatory differences between London and England and Scotland. And in such cases, we have met the spirit of the recommendation as far as reasonably practicable. Extensive work has been undertaken to ensure that we've considered and acted appropriately in response to each of the recommendations, and these are wide-ranging and relate to training, policies, procedures, resources, and indeed equipment. And Mark will come into those in a lot more detail in his presentation, as I say. I think the holistic approach that we took to actioning the recommendations, which was done by a cross-function and cross-directorate team, has been very effective. And how we now analyse, consider and manage incidents that take place within the built environment that occur both in the UK and elsewhere in the world will now be choreographed through that group from now on. And that's prevention, protection, the operational element to it, and the training element to it. And there's some clear linkages to also null, which Stuart will come on to talk about shortly as well. Today, I think it's reasonable to say that our engagement with partners through the Ministerial Working Group has proven to be absolutely invaluable in progressing legislative and regulatory, easy for me to say, issues that lie out with the ability for SFRS to progress these in isolation. And an example I'll probably point to is around about broadening the scope of some of the work to include sheltered accommodation, which was always seen as a quite considerable risk for Scottish Fire and Rescue Service. And those relationships allowed us to put that in along with the high-rise specific work that was getting progressed. And as a result of that, there's been sector-specific guidance produced by Scottish Government to support that. We obviously await the outcome of phase 2 of the Grenfell inquiry. However, in the interim, we continue to monitor the progress of that inquiry and anticipate and act upon any emerging issues that are identified through that process. So the recommendation from this paper is that SDC scrutinise the closing report that has been provided.
Thank you, Stuart. Thanks for the overview. Again, focused overview. Appreciate that. I was left, having read this, with feeling of pride in the way you've gone about this, and you mentioned the holistic approach was effective. For me, I read that and saw effective and appropriate. It seemed to be a very appropriate way to deal with what was a massively complex phase one report with a lot of different aspects within it and over different legislative boundaries, etc., and national regulations. So I was impressed, and then I went on to read the action plan in detail, and was just really very impressed with the level of detail that's gone into that and all the different aspects of it. With that brief note, I'll just hand over to Leslie and then Paul.
Thanks very much, Stuart. Over a number of occasions in the last couple of years, I've raised questions about our response here, both in meetings and offline. And I have to say, on each and every occasion, I have been reassured by Stuart and by Ross on our response, and I have been 100% reassured. It's great to see this report, and just well done indeed for keeping a focus on this at a time of a huge number of other pressures. So many congratulations, well done. Thank you.
Right, thank you. Thanks for that endorsement, Leslie. Paul and then Angelina.
I'm also reassured by what I read here. This is obviously supremely complicated, and the interconnection of the different parts is challenging for any organisation or group of organisations. I'm very conscious from other things I do of the role that SFRS has played in the national solution to this, because it is bigger than SFRS. I think it is always important to remember that in many ways here, Scotland is significantly different from England, and particularly from London. And we need to bear that in mind when people are talking generally about fire brigade responses. The sad thing is that this is 5 years. It's almost exactly 5 years since the anniversary of the fire. And we are still, in my guesstimate, a minimum of 1 year away from the phase 2 report, and it might be 2 years away. So I think there is an argument here for saying, how do we maintain a level of commitment and interest without either getting people complacent in this or putting too much resources into it. We almost want a light touch monitoring of this now for the next year or so, but with a preparedness to realise that there may be something coming out in the phase 2 report which will require us to do things. Thanks.
Interesting point, Paul, and I think that's probably the role of this committee then is to pick up exactly what you're doing there and keep that report going, and just bear in mind what your points there. Robert, do you want in on this before I go to Angelina, or is this on a separate point? Oh, Angelina, go ahead.
Thank you. So it's clear, as others have said, our approach to this has been nothing if not utterly meticulous. So please take my further probing in a spirit of acknowledging that as my starting point. But I think, rightly, we can yet expect some level of public and political external scrutiny on the extent to which we have absolutely taken on board all lessons. And so that's where I'm coming from here. So turning to, it's page 99 of the pack, 3.3 of the paper. And it's a point, Stuart, that I think in your opening remarks you touched on anyway, and it's this concept of, so it's the final sentence at 3.3, where I think we're saying, and I paraphrase, where we consider that meeting the letter of a recommendation is not practicable, we have taken measures to meet this spirit. Okay, so that's the bit I'm homing in on. And my question, I think, becomes almost a governance question. Where is the decision-making point in the organisation for that nuance between letter and spirit and therefore the manner in which we believe we are complying with the recommendations. I did try to find that answer for myself in the appendix, as it were, to sort of pull it out of the very detailed narrative there, but I couldn't quite see that thematic of what's the governance machinery for that judgment. Do you see what I'm trying to understand, Stuart? It's a bit of a nuance.
Yeah.
But I'm asking because I think it's the kind of point that a hostile inquirer could home in on. Hence my interest.
Yeah, it's a fair question, and just in terms of the governance around about this, so it goes through the prevention protection functional management team, and then it's progressed through my directorate management team, at which point it's scrutinised by me and my heads of function, and that's the authorisation environment for it to come forward to this group. So yeah, I'd probably have to go into a little bit more detail in terms of that point, and probably speak to Richard in terms of that governance around about that specific point that you make. So I see Leslie's waving. So
go ahead, Leslie.
This point has come up in previous discussions in this committee, Angelina, in relation to Grenfell, and as I'm going to suggest that perhaps we either stop using that phraseology or we explain that phraseology every time we use it. And perhaps as an example, as I understand it, English fire legislation is, or some English legislation is different to Scottish. Therefore, the exact recommendation actually just doesn't apply in Scotland. And therefore, we do the equivalent, which meets the spirit, meets the intention, perhaps meets the intention of the recommendation might be better than spirit. But this wording keeps tripping us up. So can I suggest that either we stop using it or every time we use it, we explain it in a footnote or in the context? Thanks.
Excuse me, sorry. Was Angelina's question there more to do with, are we satisfied with the point at which that decision is made? That not so much that an understanding of the difference between one and the other. Personally, I'll throw a personal view in here. I would be quite content with the senior leadership team and the service delivery expertise to be making that decision entirely as an operational matter, and we are then just scrutinising that report. However, that's my own personal view.
Yeah, and if I may, Chair, for clarity, I'm not at all proposing that should come to a governance committee. My point is there an internal escalation process to the appropriate seniority of colleague who then says, yeah, that's the correct judgment, that one is not fully deliverable to the letter, I am satisfied. But I think Stuart's answer to me has already reassured me on that point, to be honest.
Yeah, and if it provides additional assurance, Angelina, I've been involved in the Grenfell response since the day after this took place, you know, and I can absolutely assure you that every line of that action plan that gets scrutinised at my service delivery DMT, and on a number of occasions that has been rejected and sent back to the group to reconsider, have we provided enough evidence? You know, have we clearly set out what we're doing? Do we need to do more, etc.? So hopefully that provides an additional level of assurance.
I am well assured. Thank you very much.
Great, thank you, Richard. And your hands up, down. You happy not to speak?
Well, I just everything's happening as I'm thinking it. People are saying it, so it's fine. I think it's just that point about there's clearly internal governance around this work, which you've heard about. The assurance that this committee are taking is there. However, I was, in terms of just thinking aloud, Chair, if you just allow me, the implications and the strategic sense of the importance of this, which I think Angelina's also getting at as part of this. I think from an assurance perspective, this committee having been assured, and your position then to the board as chair of this committee to provide that assurance to the board should it ever raise itself, which it obviously has and does, is I think well understood. And it's something clearly that, as you've seen, lots and lots of work has gone on around this work, which is easily communicatable to the rest of the board, either through your own updates or through information that we can share. So it's just that point around assurance, I think.
Noted. Thank you, Richard. I'll go to Robert and then Paul.
Thanks, Chair. I'll be really quick on it. I thought the paper was excellent again, and very impressed with the amount of work that's gone in to satisfying these recommendations of the Phase 1 report. I wasn't unfamiliar with this because I spent 2 days last week going through our own draft thematic inspection report in relation to high-rise firefighting, which is coming to a conclusion, and I'll give you more information when I give my update later. But I just wanted to give assurance that we are cited on the amount of effort that's gone into this. We are cited on that multi-agency approach that was put in place under the Ministerial Working Group very early on in the process, and the service's role within that, and as well as making a number of recommendations and highlighting a number of areas for improvement in relation to high-rise firefighting, we do pull this particular piece out as an area of good practice, and we highlight the efforts that the service has taken in partnership with others to resolve the outcomes of the Grenfell inquiry. So we have a spotlight on this in a positive sense, I guess, within that report, and hopefully that is reflective of what we're reading here today.
Thank you. That's assuring to hear that, Robert. Thank you. Paul, and then we'll close this item off.
Very quickly, I think a lot of this concern about the phraseology in that paragraph is because of the different legislative systems north and south of the border. My strong feeling is that Phase 2 report will apply much more to England and the systems down there, and we'll have to be even more nuanced and sensible about how we handled in the north. And the legislative situation is clearly changing down south with the new building bill, which is going to mean that there is going to be greater divergence between England and Scotland. And we should not be ashamed about stating that formally, because that will influence how we tackle different recommendations as they come forward. And I just wanted to highlight that point about the increasing divergence to fellow committee members.
Paul, and your comments are closing words to Stuart.
Thank you. Sorry, apologies, Chair. Just thank you very much, obviously, for the very positive comments from the committee. And Leslie, you triggered something in my head there when you said that that specific wording has been raised previously at the board. When I provide as part of next service delivery update at the full board, the Grenfell update, that point has been picked up before. So it was remiss of me not to kind of address that in a bit more detail. So thank you very much for reminding me of that. All I would just kind of add finally is that much of the work that's been done we're at the starting point, and there's various pieces of work ongoing at the moment to roll this work out. So this is definitely not the end. It's just really the beginning of quite a considerable amount of work that needs to be done. And as I say, we've got that built environment group and the high rise improvement group, which will continue to focus on this as we go forward. So it will not drop off the table, and we'll continue to have a focus on it. And that obviously escalate depending on what the outcomes come from part 2.
Thank you. Thank you to all. That was extremely valuable and very interesting. Thank you. Let's move now. We are quite considerably behind time. However, it has been a valuable conversation, so I've not wanted to curtail this too much, and I don't want to curtail the next part. But welcome, Stuart. Nice to see your face on the Service Delivery Committee, and over to you at 9.3.
Thank you very much, Chair, and morning, colleagues. So I'm conscious of time being tight, but yeah, Stuart Nicholson, Head of Service Delivery for the East of Scotland, but also in terms of today's presentation, being involved with the National Operational Learning collaboration between the NFCC services and the Central Programmes Office, National Operational Guidance. So it's I'll keep some of the slides fairly short and may skip over some of the slides quite quickly, but hopefully in the next few minutes just provide an oversight of the journey of National Operational Learning, some of the challenges, both as a project but also as business as usual, and very much the contribution from the Scottish Fire and Rescue Service International Operational Learning, and hopefully that relationship between National Operational Learning and the Scottish Fire and Rescue Service. So your faces will probably disappear. So if you don't mind, I'll just share my screen and just shout up, please, when you can see the presentation.
I think we're there.
Okay, I'll keep going then in whatever format it's in. So just an overview of the National Operational Learning, as we say, up to May 2022. So in terms of the journey with the sort of around National Operational Learning and the sector, it's been recognised often due to tragic circumstances that the sector's learned, and there's incidents up there going back many years to sort of Smithfield Market, but also in the 90s, Gill Industry, and more sort of latterly after Tudun Stour, where time and time again, number of sort of recommendations were made to the sector about how we learned from operational incidents. Really all brought to a head to a certain extent. Two incidents that I would bring to colleagues' attention is the death of Stephen Hunt in Greater Manchester, and also events around 7/7. And as you can see there, in terms of the recommendation from Nigel Meadows, that sort of in many ways instructed the sector around having a national and consistent approach to the sharing and the benefits of operational learning, but also by how services would understand action and embed any learning that was sort of gathered UK-wide. At the time, like I said, I'll skip over some of these slides fairly quickly due to the time constraints. But at the time, sort of previous to National Operational Learning, sort of 2014, 2015, and a lot of this was being supported by other reports, such as the Pollock report, in terms of how learning was being done across all emergency service, not just the fire sector, but broadly speaking, there was a view that the learning and the continual improvement operationally by fire services was obviously fragmented. And the main one at the bottom there, there was evidence that events and incidents within services wasn't being shared outside of the services. And actually this was happening multiple times across the UK. And that was one of the drivers for establishing National Operational Learning. I became involved with the sort of the project phase, like I said, back in 2015, 2016. And in two main purposes at the outset of that work was about improving firefighter and public safety, and also around taking a more modern and professional view of continual learning. That latter point was very much focused around the culture, and there was a lot of work done with other sort of high sort of risk industries, including the petroleum industry and also the civil aviation industry, about the transparent and open culture within sector and how that can benefit the sharing of learning between fire services. And a lot of effort has gone into that latter point over the last sort of 6 and 7 years. And I do believe the sector has come a long way in terms of that willingness to share. And, you know, the terminology is often about sort of washing sort of the dirty linen in public. And as I said, you know, less than 10 years ago, very much a view that it was kept within house and rather than sharing for the benefit of all. So sort of 2016, like I said, I started to become involved with the NFCC, National Fire Chiefs Council, and the learning. And since then, there's been a number of milestones. 2016, there was effectively the first edition of the Good Practice Guidance for Services. You know, at the time, what good looked like, and a broad framework that services could follow to contribute to a UK-wide learning portal. We received our sort of first learning submission in 2017, and then in 2018 there was a platform or a toolkit that was developed where services could contribute, and there was also, we'll see in a couple of minutes, the establishing of a technical solution where services could contribute their learning. At that point, there was also a user group established that I now chair, which considers the learning that is contributed by services UK-wide. And then latterly, this year, we received our 400 case of learning from services. So we're getting a real broad evidence base and foundation for that kind of learning. The system is established on and sort of predicated on a strong foundation of a sort of learning and assurance within service, which is sort of demonstrated in that slide on the right-hand side. And again, sort of information for colleagues on the call, you know, that is well established in the Scottish Fire and Rescue Service in terms of how it considers its own internal learning. But then there's the opportunity to contribute to the sort of slide on the left in terms of that national learning, and that generally then has the opportunity for that learning to be firstly analysed, but then also consideration given to how that can alter items such as guidance. The learning itself is just in terms of the mechanism for learning. Like I said, typically the learning at the moment is received from the UK Fire and Rescue Services, that sort of diagram on the left-hand side. It's collated by a secretariat, and then it's considered within the National Operational Learning User Group. Sorry, just take that one back. It's catching up. So it's considered within the National Operational Learning User Group, and the slide at the bottom was around the opportunity to alter sort of guidance, but also feedback to fire and rescue services, the trends and analysis that's been followed on a national sort of basis. Again, I'll skip over this relatively quickly, but that sort of explains the process. As I said, cases typically submitted for fire and rescue services. There's a prioritisation carried out, and then there's analysis of the work that's contributed by each fire and rescue service. It's reviewed by that user group, and then action taken in terms of feedback to the UK-wide fire and rescue services, but also considering whether the guidance and the national guidance needs to be altered. Like I said, extremely proud as a sector that over 407 cases now have been received in what's considered to be a relatively short time period. Just sort of considering the buy-in from the sector, it's seen as a real positive. Likewise, all UK Fire and Rescue Services now have contributed. Scottish Fire and Rescue Service are an active member of that user group. They are an active member contributing case studies, and just an example more recently is the presentation that's provided to that user group from the recent Elephant House sort of incident in Edinburgh. The learning contributed from the Scottish Fire and Rescue Service now in terms of a firefighter safety resource within the service has meant that that is now being considered by all UK-wide fire and rescue services, something that was relatively alien to the majority of other sort of fire and rescue services throughout the UK. but it's now being seen as very much as good practice, and other UK-wide fire and rescue services are considering how they can utilise the sort of the practices within Scotland. I sort of homed in at the start of the presentation around that sort of keeping the firefighters safe and considering the culture. As I said, in terms of the more recent review, we've undertaken a recent review of national operational learning. And the two sort of standouts I would suggest are that sort of cultural change within the sector in a short period of time, and that willingness to share good practice and learning, and also areas of improvement, but also a platform where all UK-wide fire and rescue services can contribute and add to with their internal sorts of learning. Culture, as I said, it's relatively difficult to measure, but the feeling in that review is very much that there's been great sort of strides made with the culture within the sector, and ongoing engagement is very much taking place around that sort of the benefit of sharing. Areas that I'll just bring to colleagues' sort of attention, the three kind of stand out in the last sort of 2 years, and again, we're just about to hear a contribution from David around, is the rise in the incidents involving lithium-ion batteries and associated risks for firefighter safety. Water rescue, and this was an interesting one from a national operational learning point of view. It was very much a initial kind of contribution by a fire and rescue service that had a near miss with firefighter safety around water rescue, and they sort of brought it to our attention around. I'm not sure if this is happening sort of on a sort of UK-wide basis, but this is an event that's occurred locally. Within 6 months, we'd received 25 more cases UK-wide around both public safety and firefighter safety involving water rescue, which has led to a number of sort of work streams to including a change in guidance around water rescue and attending water incidents. And then latterly, it's the use of operational discretion, whereby incident commanders have the opportunity to step outside of the sort of the framework of policy to bring a incident to a successful conclusion. And again, very much services are contributing on a regular basis, and that's adding to a real sort of healthy conversation and debate around how operational discretion is firstly utilised, but also, you know, when it's being utilised. In terms of, again, the recognising over the last sort of 3 or 4 years, the majority of the learning that has been received into national operational learning, and we've heard from other colleagues about that wider context around Grenfell and the operational sort of response to Grenfell. But predominantly the learning has been after the event and also received purely from fire and rescue services within the UK. The next aspiration and the plans in place within national operational learning include that wider gathering of international learning for, you know, and we've already started to build up relationships with partners around the world. That wider horizon scanning and sort of data capture and a forward look rather than sort of, like I said, receiving information after the event, often involving public or firefighter safety. And within the last month, there has been agreement to build the relationships between the sort of the fire sector at a practitioner kind of level and the benefit of academic learning that is within the sector as well. So, and I recognise I've taken yourselves through quite a sort of gallop through there just with the confines of time, but hopefully that has been one, a whistle-stop tour, but also useful in terms of providing a bit of context around national operational learning, but happy to take any questions.
Good. No, thank you very much. I've just managed to do, excuse me. Managed to do something with my screen that made you disappear. Unless you feel you need the presentation, could we just go back to the overall normal screen, please?
I'm just trying to do that now.
Stuart, first of all, thank you very much. Fantastic. This presentation, for colleagues who may not be aware, this presentation came about because we recognise that as part of the, as the Service Delivery Committee, members are not fire and rescue experts. So what we do is we do spend a significant amount of the time getting up points of interest and educational pieces for us, and that was most definitely one of them. So understanding how the NFCC and the National Operational Learning Group then apply to the Scottish Fire and Rescue Services mode of operation through the National Operational Guidance, etc., is an important aspect. So thank you, and we've benefited from your thoughts. Just one quick question, because there may not be that many other questions, but in terms of benchmarking, do you see the do you see the role of the National Operational Learning Group as a group that then put out best practice, and then really it's up for individual fire and rescue services then to say, okay, that's the sort of standard we should be aspiring to, and we should be adopting that guidance?
Very much so is the short answer. So it was raised very much at the early stages in terms of what, and we've had the conversation already in terms of what can be mandated for services, and it was just recognised in terms of it is purely that environment of providing best practice, providing learning, providing issues if services need to be made aware of issues, and then it's down to the individual services to take that sort of learning and adopt it and embed it if they want to, you know, and it varies depending, as we've heard already, around the statutory responsibilities of the different services. And whilst learning and operational learning can have an impact for certain English fire and rescue services, it doesn't for devolved. And likewise, from an English perspective, their operational response is predicated on their integrated risk management plan. So some learning doesn't have an impact on certain services. And again, learning potentially in large metropolitan services such as London or Manchester will have no implication for places perhaps like Northumberland and Cumbria. So it is very much around, as you suggested, Chair, you know, good practice being sort of published, and then it's down to the individual service.
No, thank you. Thank you. I think unless colleagues have got anything further, I'll just come up to Ross, and then we'll probably close off this item. Ross.
Thanks very much, Chair. And I just wanted to make a couple of observations, if that's okay, Chair. We've had a number of reports there in terms of the HMFSI action plans, the Grenfell action plan, and now Stuart's presentation on Knoll. And hopefully it demonstrates to the committee, you know, that we are truly a learning organisation, and we do try and take learnings from wherever we can and implement it within the organisation, ultimately to improve the safety of our firefighters and the safety of communities. We spoke earlier about governance, and clearly all of those different elements have different governance arrangements, but I just wanted to put across my own personal thanks to the committee, because a key part of the governance and ensuring that independent, although you're part of the organisation, clearly that more independent look at what we are doing, I find really helpful and reassuring. So I see this committee and us bringing these things to the committee as adding real value and assisting us with that governance and making sure that we've got an independent look at things. The final thing that I would probably say, Stuart mentioned culture. We are really trying to change the culture of the organisation. As Stuart talked about, you know, things maybe not being open and transparent 10 years ago. We are doing an awful lot of work in order to try and improve the culture of the organisation, so people are very open and upfront about things that we can all learn from. You know, it's not a case of us seeking to apportion blame, far from it. We want to hear people's experiences so that we can learn from that, and as I've already said, improve the safety of firefighters and communities. And as well as the Elephant House case study that Stuart mentioned, we've also put out a case study recently in relation to Albert Drive, which, as well as internally, we've shared that across the UK Fire and Rescue Service as well. So, and the final thing is, Stuart had a command seminar. Stuart Stevens led a command seminar a couple of weeks ago, and that's all part of that culture of learning from one another and being open and upfront about things. So, and I certainly see really positive strides being made in that regard. So, thanks very much, Chair.
Thank you. Thank you. Nicely summarised. Thank you, Stuart. Interesting presentation. Very much educational for us. Thank you. Colleagues, we are about 40 minutes behind. I'm going to propose a very quick comfort break, literally 135 seconds worth. So if you'd like to pop off, come back and don't be late. Thank you. Welcome back, everybody. And this item, welcome, David. And I just hand over to Stuart. David, I just items to the heading of climate change. We started it just about the time of Climate Change Conference 6, and we've continued it on now for, I think this is about the lithium-ion battery technology, and very interested to read your brief, David, and over to Stuart. Thank you very much.
Thank you very much, Chair. So yes, this is the latest in the sequence of papers that will talk around about climate change related issues. And I'll shortly introduce David Dooley. David heads up the protection element of our prevention protection function, and that includes fire safety enforcement, fire engineering and fire investigation. The paper kind of pulls together three different strands. There's a P&P element to it, and the fire investigation work that's ongoing to identify lithium-ion battery incidents. There's the operational response element and the linkages to the operational strategy in terms of how we will deal with these incidents in the future. And then there's a point around about the ongoing work at the moment in terms of bringing into service an EV appliance, an electric appliance. And fortuitously, Stuart Nicholson is the project lead for that, so can provide any more detail should we require it. So, without further ado, I'll bring David in, who will give us orientate us through the paper.
Thanks, Stuart. Thank you, Chair. Good afternoon, everybody. Yeah, the paper is provided as an update for the committee to cite you on the emerging risks that are presented by the presence of lithium-ion batteries and the work streams that are currently being progressed in SFRS in response to that risk. So we live in a world, and I'm sure this is no news to anybody, we live in a world where we're surrounded by technology that relies on power provided by lithium-ion batteries. Everything from wristwatches to, more recently, buses, trains, and I believe there's some light aircraft being tested using the technology now as well. Technology itself is not new. They've been in circulation since the early 1990s. However, their use and their application is becoming more and more widespread, and it's across a variety of different applications that the technology can be used. By using it in appliances, equipment and machinery, you can utilise a power source that provides a larger capacity, a longer life and a steady power output, which is key to electric and electronic items doing their job. The performance is far superior to that of the predecessor, the lead-acid battery, and for these reasons they're a key component as governments, organisations and industry attempt to reduce carbon emissions by introducing greener technology in support of a net zero approach. So I've already mentioned that lithium-ion battery technology is commonplace within our communities, and although current data, which I'll touch on later, is not identifying any emerging trends at the moment, lithium-ion battery-powered equipment will become more and more widespread. And as the technology improves and evolves, and we adopt a greener approach, that risk will increase. The most obvious visual risk indicator is the increase of electric vehicles on our roads. But what we don't see is the technology being integrated into our infrastructure and the built environment, where we've got storage systems and innovative power solutions being installed within our communities. In addition to drive and reduce carbon emissions and protect the environment, the recent fossil fuel price increase and the scarcity of that is likely to further accelerate greener solutions in the future. SFRS are cited on emerging risks, and we're taking proactive steps to ensure we continue to learn, understand the risks, and act upon these so that our community safety and firefighter safety is maintained. So the risks are relatively low from lithium-ion batteries, and I'm not a chemist, but understanding is 4 main parts to the battery: the cathode, the anode, the separator, and the electrolytes, and that's contained within the cell. The risk is generally low when they're in a steady state, but as the battery is used and goes through a process of discharging and recharging, the components within the battery experience a slow degradation. And when that happens, heat can be generated. If there's sufficient heat generated, that can result in failure of one of the components. And when you have a failure, you have the potential for a short circuit. When you have a short circuit, you have the potential for a fire, or in extreme circumstances, an explosion. So that's the battery in normal use, discharge and recharge. And as that battery gets more exposed to that process of cycling through that charging and discharging process, that risk potentially increases. Albeit, as I said, we're not seeing a significant emerging trend in that respect. The other risk to the battery is the risk of mechanical damage, which we can't protect against as such, other than putting protective measures in, physical protective measures in to protect the batteries from mechanical damage. But the same issue applies. The short circuit can happen if there's an impact on that cell. You have an increase in heat, you have a rapid deterioration of the chemical separation within the battery, which in turn increases heat and creates a phenomenon known as thermal runaway. And thermal runaway is a cascade event that is out of control, uncontrolled. It produces large volumes of gas from that cell and then can result in fire and in extreme cases, an explosion. So as the technology is developing now, we're seeing batteries that are producing a higher output, they have larger capacity, and as they become more prominent in society, the risk of a failure and the likelihood of that failure will increase and require an SFRS intervention. At the moment, we have good information through national operational learning, as the DACO touched on previously, and our generic information, our standard operating procedures, our safe systems of work are all in place so that we can respond to incidents effectively. Our operational intelligence process captures information where there's lithium-ion battery risks in our premises within station grounds. From a prevention protection point of view, we already chair the Electrical Safety Working Group, which is an evolution from the White Goods Safety Working Group that kicked off in 2018. And that group consists of partners from industry, Electrical Safety First, Trading Standards, and Scottish Government. In that group, we share information in relation to electrical safety, and lithium-ion batteries are a standing agenda item. Looking forward, the operational strategy outlines our commitment to focus on safety and provide effective emergency response to the changing risks. As an organisation, we're constantly evolving, and I know that's been touched on previously. We are learning and we're alive to this particular risk. The hazmat SOP has recently been updated to reflect the lithium-ion battery risk and take cognizance of the increase in vehicles that are powered by lithium-ion batteries and the systems that are within the built environment for power storage solutions. By doing that, that provides an appropriate rate of response to incidents involving lithium-ion batteries to ensure that firefighter and community safety are both maintained. Simultaneously, our operational function have their research and development team who are testing new technology, most recently evaluating the effectiveness of a large fire blanket specifically designed to provide effective intervention when dealing with vehicle fires that are powered by lithium-ion batteries. That's in partnership with Edinburgh Airport, and I'll touch on that in a little while. Further learning is required though, and we're aware that lithium-ion batteries can also have a second life. So initial life is done, it goes to a recycling facility whereby the battery is reconditioned and then re-released into communities for a second use. And that's developing at the moment and evolving. We're not aware of what the risks are. I think worldwide we don't really know what the risks are at the moment, but that's something that we'll need to keep an eye on as second life batteries start making their way into our equipment, our vehicles and our homes. In terms of ensuring that we support that continuous learning, we'll monitor lithium-ion battery fire incident trends. We'll analyse the data with colleagues in Power BI. We're engaging with NFCC, specifically through National Operational Learning, and we're engaging with wider partners through industry and academia. We'll share the information and develop training packages appropriate for personnel in the service, and we will most importantly prepare for fires involving lithium-ion batteries to ensure that our crews are safe and our communities are safe also. To provide that oversight going forward, P&P are in the process of establishing a lithium-ion battery working group, which will coordinate the activities and consider the risks and actions relating to electric vehicles, the charging infrastructure, firefighting tactics, the risks in the built environment, and firefighting procedures and equipment. The group will ensure that organisational learning is realised and supported as new and unknown risks emerge. I've said that the fire risk is relatively low from lithium-ion batteries, and you'll see from the paper in section 3.16, the data provided confirms that. In terms of electric vehicles, we've had 2 fires as a result of an RTC. We've had 1 fault in a domestic charger. We've had 1 fire due to a dismantling process, and we've had 2 false alarms with good intent. In terms of battery cells themselves, we've had 3 e-bike fires, 1 electric scooter fire, 1 golf caddy, 3 batteries within premises, 2 batteries at waste facilities, 3 mobile phones, and 1 vaping device. In terms of supporting that ongoing learning, we've got established partnerships in place. We're a key stakeholder within NFCC, as the DACO has just covered, and the benefits of that are easy to see, and we're maximising that opportunity as well to learn from that group. We're working closely with Edinburgh Airport, as I mentioned earlier. They've recently introduced electric vehicles and infrastructure to the airport site, and they're keen to engage with us to get our expertise, but also share information with us for joint learning for both organisations. And of course, as Stuart mentioned earlier on, we have the Future Concepts workstream whereby we are developing an electric vehicle fire appliance in partnership with Scottish Government, Transport for Scotland and Emergency One. This is the first challenging step to replace our appliance fleet and move from a diesel fleet to something that's a bit more sympathetic to the environment. The appliance is due in service in early 2023, where it will be subject to a rigorous testing regime prior to going operational in a trial role for 12 months. And that evaluation will then inform how we move forward in terms of future fire appliance design. From a service perspective, asset management have made excellent progress elsewhere across the fleet in support of reducing our carbon footprint. We now have 172 electric vehicles in service that have replaced previous petrol or diesel equivalents, and we have 61 sites across SFRS with 124 chargers available for that fleet of vehicles. In terms of ongoing communications to effectively share the learning and support understanding, we continue to utilise and refine our established processes. That's using social media through Facebook and Twitter and our youth safety pages. FI are aware of the risks and are identifying those during the process of investigations and sharing that across the wider service. Our FSE teams are alert to risks and are engaging with duty holders where they become aware of lithium-ion battery storage facilities within premises. Fire engineering are alert to new proposals coming into service through the consultation process and are notifying operations in that respect, so our crews are aware of the risk within. And our internal notification processes such as awareness briefings, service delivery alerts and urgent instructions will be utilised as and when required where we find information that is urgently needed to be distributed in terms of firefighter safety. The strategic implications are detailed within the paper. I won't cover them just now. I'll let you look at them if you haven't already done so. And service delivery are asked to note the content of the report and the progress being made in response to the current and emerging lithium-ion battery risks. And I'm happy to take any questions. Thank you, Chair.
Thank you, David. Fascinating subject this, and one in which it was an interesting report to read through. Thank you for pulling this together. I was just one observation, doesn't necessarily require a comment really. I was interested to read of the relatively, what I thought, low numbers of incidents that occurred with lithium-ion batteries, which is either meaning that we may or may not be recording them correctly, or that actually they are reasonably okay. I think we tend to sensationalize in the news about things exploding, but I don't know. It's a way ahead, and also, of course, battery technology itself has got to change significantly globally because of lack of some of the really very limited resources that go in to make some of these high-end performance batteries, particularly in cars. So it's an interesting and emerging topic, I think, and one in which, as your paper indicates, that the service will have to keep on top of, and as much to keep the public safe, but also our firefighters safe. So thank you. As with a lot of these things, David, please don't take the lack of questions as an indicator of your report. It's a very much for information report. Does anybody have any questions? No. Okay, David, thank you very much for your time, and it's great to see you at the Service Delivery Committee. Thank you very much.
Thanks for that, Chair. Thank you. Bye.
Thank you. We'll move rapidly now across to item 11. I'm not quite sure. Oh, yes, it's Ross. So do you want to just a quick few words about the risk log, please?
Thanks, Chair, and it will be a very few short words. You've got the committee-aligned Directorate risk register in front of yourselves. I'm conscious of the fact that Mark's going to be speaking specifically about high-rise as the risk spotlight. So the purpose is just to provide you with the risk report for those risks that have been deemed appropriate for the Service Delivery Committee to scrutinise. There are the usual 8 appendices that are attached to the report, some of which are blank because there's a nil return, and the committee is asked to scrutinise the Service Delivery Committee risk report and identify future risk spotlights to be provided to yourselves. So I'll pause at that point and take any questions in terms of any of the detail. Thank you.
Thank you, Ross, and thanks for your brief oversight there. I'm always, whenever I read the papers, I'm always a little bit taken aback by the level of risk we carry, but then reassured when we look at the mitigating factors and, well, partially reassured by the mitigating factors and the risk control summaries. One point that was relevant to some of our earlier discussions was, let me see if I can get this, the risk control summary. Bear with me. Never find it when you get quickly, can you? There we go. Page 170 of 199. Control comments, basically just reinforcing our view about the GTAC tablets again, and just really saying for us, so Service Delivery 004, standardization of service delivery, and the operations document review, really just reinforcing the need to come back next time for the GTACs on it. So unless anybody has any particular comments, I am continually reassured that we have got a handle on this, and whenever I've asked questions in the past, Stuart's been very quick to answer them. So I don't have any problems. Tim, go ahead.
Yeah, very, very quick one, Nick. It kind of builds on what you were saying before. It's on page 179 of the pack. It's a new director at risk. And I note that there's a comment in the risk description where it says this could occur if there are further ICT issues, which implies that they've already had some, which it kind of speaks to this issue around how our reliance on the internal resources something we need to think about if we're going to make sure we keep on top of these things.
I think you're right to highlight that, and I think that and earlier comments, particularly, if I'm correct, from Leslie, forgive me if I got that bit wrong, is something that we'll bring up at item 14.2. Excuse me, sorry. Thank you, Tim. Does anybody else have any comments to make about this item? No. Okay, thank you. Can we just move on then to the risk spotlight and back over to you, Stuart, for the introduction. Thank you.
Thanks. Just I'll quickly introduce Mark Duffy. Mark Duffy is one of the area commanders within our operations function, and from an operational perspective, as part of that high-rise improvement group, has been leading the operational elements of that and has done a lot of work. This presentation brings to life some of the earlier discussion and some of the points that were in the Grenfell paper, just around about where we were and where we are now, both from a prevention perspective, but also operational. So it might be a kind of joint effort between Mark, David and myself, but I'll let Mark lead us off.
And just before you do, Mark, and I don't wish to curtail the presentation, but we are running a bit behind time. So if there's any bits you feel that the committee members would have already read, feel free to skip over those.
Thank you very much, Chair. Thank you and good afternoon, everyone. I'll just start the presentation just now, Chair, and I will absolutely skip over a couple of slides. Can I just confirm, Chair, that you see that first slide?
My apologies, I should have said yes, I do. Thank you.
Thank you. Thank you very much. As we have an introduction to the presentation, I will give a very quick recap on Grenfell and then move on to the main discussion, focusing on the changes that we've made as a result of the fire. So we do know the fire occurred on the 14th of June 2017. It was caused by an electrical fault within a fridge freezer on the 4th floor of a domestic property, which then spread rapidly up the building's exterior due to inadequate and unsuitable building cladding. The building cladding, which was aluminium composite material, or ACM as it's most commonly known, incorporates a very highly combustible polyethylene filler which melts, drips and flows at elevated temperatures, and unfortunately 72 people died as a result of the fire and 74 people were injured, with 223 escaping, including 65 that were rescued by the London Fire Brigade. Although Scotland has experienced previous high-rise fires, the most significant being back in 1999 in Irvine, our data does indicate that high-rise domestic buildings are no greater risk than any other property type. We have 840 domestic high-rises in Scotland, which are subject to quarterly operational assurance visits, those of which are completed by operational crews. So the value in operational crews carrying out these OAVs are quite considerable, as it provides familiarisation on vehicle and building access, hydrant locations, internal layouts, location of firefighting facilities, and this all aids in gathering operational intelligence, which can be stored in the GTAC tablets located on the fire appliances themselves. We also have a high-rise indicator plates fitted to approximately 540 domestic high-rises in use, and that again supports our operational intelligence and our crew awareness and familiarisation. The prevention and protection function and senior management have played a huge part in ensuring that the whole of the service have not only understood the changes we needed to make as per the 44 recommendations, but also what we have completed so far and what's still to be done. Our colleagues in P&P continue to engage and play an important part in the Ministerial Working Group along with other partners and have supported and influenced certain changes in legislation. Some of these changes include evacuation systems becoming mandatory in the new builds over 18 metres, and the banning of all the combustible cladding over 11 metres, and that not only includes domestic properties but also care homes and hospitals over 11 metres. They will also be responsible, or have been responsible, for monitoring and reporting on Grenfell Action Inquiry Phase 1, and this will continue on to Phase 2. They have also reviewed the training provision for operational staff undertaking operational assurance visits, and the previous inspection procedures for multi-storey flats was changed to high-rise operational assurance visit procedures, which now provides detail and information on firefighting lifts and evacuation systems. Training our operational staff and ensuring firefighter safety has been a focus of the 44 recommendations, and the service has increased and developed on both these topics. In regards to training, our Logos courses are delivered by SMARTU, and the SFRS Incident Command team have developed an introduction to Logos PowerPoint presentation, which is now available on our LCMS. These Logos courses will ensure that we have that formal record of decision making and rationale, and they can be used not just primarily for major incidents, but also incidents that may have significant organisational, political or reputational impacts to the service. The Incident Command structure at an operational incident does remain the same in getting the correct resources in place to meet the needs of the incident. However, we now ensure that evacuation and fire survival guidance are considerations in the Incident Commander's tactical plan. We have tested and exercised on numerous occasions over the past few years, with more exercises planned this year. Our exercises have tested Incident Command, the challenges of the stay put procedure, and members of the public leaving the building against fire service advice. Fire survival guidance tabletop exercises were conducted at Johnston OC to test a high-rise SOP, which has been updated, and this now includes a fire survival guidance section. This tested OC protocols, the recording methods, their incident support room duties, and the evacuation procedures. All these exercises have been fully debriefed, and we were provided with very good feedback from operational personnel and crews on the evacuation boards, and the fire survival guidance. We have also improved and updated our learning content management system, so that's our e-learning platform. So the content of the building construction module has been updated, and we've now completed a bespoke module which also discusses cladding on buildings. We have an external fire spread training module that's been developed and is available and is scheduled for delivery to operational crews as part of the new training and operational competency framework. We're also currently looking at tactical ventilation and bringing that into the new document conversion project, and we're looking at redistributing some of our fans, and a positive pressure ventilation fan model will be developed under the scope of the service's operational strategy, which went live in April this year, that the Deputy Assistant Chief Officer mentioned at the start of the meeting. Training has also delivered on enhanced command support units, how we will manage evacuation, and how our operations control room staff will be pivotal in all of this. It's important to note that the Scottish Fire and Rescue Service have good policies and procedures in place prior to Grenfell, and we had a high-rise standard operating procedure since 2013. We have, however, made adjustments to the SOP, which includes additional information to this construction and design of high-rise, dedicated spotters positioned on all sides of the building, and they're tasked to watch and monitor fire condition, identify any rescues that are required, and also monitor the structural integrity of the building. We do have a very good breathing apparatus and Incident Command policies and operational guidances. We have made slight amendments over the years, which includes BA emergency teams tasks, committing BA teams above a fire, and additional support for the firefighter safety resource, which is in place to ensure that we have a proactive and planned approach for responding to firefighter emergencies. And that firefighter safety resource is also heavily incorporated into our Incident Command courses, particularly our ICL 2 and our ICL 3. The evacuation policy, which is now out for consultation, will be a standalone policy due to its importance. The stay put procedure is our default position, which has been tried and tested in Scotland. And this is a predetermined strategy that requests the occupants remain where they are unless they are directly affected by fire, heat or smoke. And this strategy absolutely relies on the principles of compartmentation combined with other fire protection provisions. The document now details the procedures on how to prepare for two types of evacuation. The first being a partial evacuation, which will include the first floor, the fire floor, and a minimum of one floor above and below that fire floor. And the second being a full evacuation, where all occupants will be asked to leave the building. And if this happens, the stay put procedure is no longer viable. A full evacuation for a premises will result in an evacuation team being established. They will provide additional resources onto the incident ground to manage the evacuation on behalf of the incident commander, but won't be used for the operational tasks of the incident. That team will include evacuation logists, officers, and an evacuation command support unit, further crews and personnel from OC to assist. The standard operating procedure also details the main evacuation and evacuation bespoke boards that are being procured at the moment that we will use to collate all the evacuation information from the fire ground itself. I've added a couple of more slides onto this presentation. I was aware that there was quite a lot of text in my presentation, so I've added a couple on. First of the first slide that I've added is the introduction of smoke hoods, which I know was mentioned earlier on in the meeting. So the fire escape hood will provide an occupant with clean air in a smoke-filled environment. It's worn over the head. It provides a tight seal around the hood itself. It prevents any smoke from getting in, so the only air that you actually breathe is through the filter, which removes any toxic gases found in smoke, providing that clear, safe air for up to 15 minutes. The service is purchasing 1,200 of these this year, and we'll keep you updated on that. Moving on from smoke curtains onto smoke curtains, we'll be purchasing a number of these smoke curtains this year. Smoke curtains are essentially a door-shaped fire blanket. They're adjustable in width and height. They're designed to block doorways to control airflow, trap products of combustion within a single compartment, and also, and most importantly, allow easy access and egress for fire crews. Most smoke curtains can be adjusted to fit any standard door and can be fitted in roughly about 15 seconds. If we could just end, Chair, on the last slide. The last slide that I've brought up there is on the operational strategy that the Deputy Assistant Chief Officer mentioned at the start of the meeting. It went live on the 1st of April this year. The strategy has been built on 7 key themes. It places our operational response at the forefront of the service, utilising the latest technology, which will benefit not just our communities, but ensure firefighter safety. Grenfell is mentioned within the strategy, and the purchase of smoke hoods, smoke curtains is just the start of our plan, and the likelihood of drone technology and body-worn cameras are all being planned for the next few years. Chair, I'm more than happy to stop there. Hopefully, I think I maybe went through that pretty quickly, but I know time was on us. Hopefully, I've covered enough points here, and I'll stop sharing and happy to take any questions.
Mark, thank you. No, from my own personal perspective, that you didn't go through that too quickly. It was good to hit these things at a pace. It was yet again a fantastically interesting presentation. There's a gut feeling for those who aren't experts in this that when we all saw Grenfell and absolutely hearts went out to everybody, and then you join the Fire and Rescue Service as a member of the board, you think, oh heavens above, I hope that doesn't happen in Scotland and to the people of Scotland or anywhere. I mean, but when you then read all the work that you've done and the specialist expertise that goes into this sort of approach to these buildings, it is very reassuring, and I'm greatly assured when I read the likes of your presentation and other work that's come to this committee previously. So thank you. There may not be a lot of questions here. Please, Mark, don't please misinterpret that. But I've got one quick question. On one of your slides, you said data indicates that high-rise domestic buildings are no greater risk than any other property type. Could you just expand on that briefly, because time still is short? But what sort of data do you refer to on that?
So that's primarily other domestic properties in Scotland. So that can be broken down into detached houses, semi-detached houses, just depending on the data that we get. But that's how we've compared fires in high rise to other standard domestic properties in Scotland.
So you're saying there's no greater prevalence of fires in those buildings than there are elsewhere?
Absolutely, yes.
Stuart, did you want to expand on that?
Yeah, Mark's answered it, Nick. It's derived from our IRS data. So within IRS, we collate that data in terms of type of premise it occurs on.
Okay, thank you. Leslie?
Thanks. That was great, Mark. Many thanks indeed. My question is about how, and I'm just kind of seeking to understand how this happens during an incident. How can you tell when the compartmentalisation is failing? And can you be quickly enough onto that so that when you move from stay put to evacuate, there hasn't been so much of a breakdown that the evacuation is more hazardous than it need be.
Yeah, but I think we can't forget that the building standards in Scotland are slightly different from you know, our south of the border. I think we are genuinely comforted in the building standards that we've got in Scotland and the standards that come on that. We do understand how a building is affected in fire, whether that be a high rise or a standard domestic property. We do teach our firefighters from an early stage to identify signs and symptoms of fire and fire behaviour and structural collapse. And I think the adjustment of the SOP, which has introduced spotters for the first time, so that will be designated officers, firefighters at different parts of the building to absolutely look out for structural damage, to look out for external fire spread, etc. So I think retweaking the standard operating procedure has given us a bit more comfort, but I'm also comforted in the fact that the training that goes on and has been on for a number of years will see us right.
Can I just briefly come back on that super, Mark? Having been responsible for a local authority building standards team, I am aware of the huge problems then that have got even worse now in terms of keeping those teams staffed up. And whilst our standards may be very good, I just would have a niggling question at the back of my mind that Paul may have a view on about the ability of building standards teams to inspect and enforce just because of the demand and the sheer low numbers that we have in that discipline. Thanks.
Yeah, we understand the pressures that are on our building standards teams in Scotland and throughout the UK. I think what's also good is the operational assurance visits that we carry out as crews. So that's just not a walk up the stairs and walk around the building and walk back out again. We're absolutely looking at a huge number of items in regards to a high rise. So we're looking at the dry risers, we're looking at the lifts, we're looking at the ventilations within the lobbies if there's anything, we're looking at the fire doors, the standard fire doors, and if there's any damages or any of these or any concerns that are raised, then we'll absolutely pass it on to the relevant partners. They're done quarterly.
Thank you. Closing comments, Stuart? No, you're on mute.
Apologies, I put my hand down and forgot to take myself off mute. Yeah, just to speak to that point, Leslie, you know, in terms of stats, 1% of fires that occur within high rises, less than 1% leave the compartment of origin. So it's very, very low. And that's testament, as Mark says, to the building standards. But we do know there are issues in terms of compartmentation being breached by works that's gone on, you know, in terms of cabling and stuff like that as well. But also reinforce the point that stay put policy in Scotland is still the right policy, but we need to have a backup plan in place in terms of should compartmentation fail. Mark's already detailed some of the practical points we've put in place in terms of spotters and stuff. The next iteration of that is around about stairwell protection teams, and it's subject to quite a lot of discussion across the fire sector at the moment, but we think we've got a kind of direction of travel in terms of that, and that just supplements that with additional personnel that can monitor for any breaches of compartmentation and stuff like that as well. So just add that, but I think Mark's covered off the rest really well.
Marvellous. Thank you. Right, we'll draw a line underneath that. Thank you very much. Thank you very much, Mark. Very interesting.
Thank you.
Angelina, noting you may have to depart now, so thanks very much for your contribution. Robert, over to you.
Thanks, Chair. I'll be very quick. You have the paper in front of you. It's an update on the work of the Inspectorate since we last met. First item is local area inspections. We published a report related to the Angus area back in March of 2022. It was a fairly positive report and a very positive experience. I think I'd like to reflect that and also to applaud the team that we met there, led by the LSO Stephen Woods. They had a really positive attitude. They embraced the opportunity to engage with the Inspectorate, and they were very open and honest with the the information that they gave us, and I think we get a better report as a result of that. There were only 3 recommendations within the report, and they were all local in context, so they won't come to this committee. There was nothing national within the report, and that is the last of the local area inspections in that format. As you know, and we've spoken about this a number of times, I am moving to a service delivery area approach. My team have been working very hard along with colleagues in the service, and again, just to put on record my gratitude to Stuart Nicholson and his team for meeting us at the McDonald Road fire premise, and to have that, again, open and honest dialogue about what they would want to get out of that inspection approach. I genuinely think it is a move in the right direction, and I think it will add more value to go down this road. We have been developing our data request, and we're in a position now that within the next couple of weeks we'll be reaching out to the service and asking for a large amount of information and data and evidence on which we can start developing our thoughts on the themes that we'll be investigating and inspecting. And then we will be within the next month or so ready to go into the fire service premises and carrying out our fieldwork phase of the inspection. We have been developing question sets, and it's proven to be a lot more challenging than it first appears. It's great when you're the chief inspector and you come up with an idea and you float it in front of the rest of the team and say, here's a great idea, why don't we change the way we do things? And then they've got to go away and figure out how to actually make that happen. There's a few people been pulling their hair out as to how they'll evidence the things that I want to inspect and how they'll be able to provide meaningful feedback to the service. But they're getting there, and they're really working hard to create those meaningful questions and meaningful data sets that will provide us with tangible evidence in a method that's consistent and comparable across each of the SO areas and each of the service delivery areas through that 3-year process. So we feel it's a work in progress, but it's certainly moving in the right direction and coming to a cinema near you, as you might say. The next element there is a thematic inspection work. We concluded our health and safety thematic with an operational focus, and we laid that before Parliament on the 26th of April. It was, again, I thought, a fairly balanced report. We set out to show that there was an organisational culture in relation to health and safety and welfare that focused on the health and safety of staff and on firefighter safety in particular. And just reading a quick paragraph from the executive summary of that report, we found that Scottish Fire and Rescue Service has a good understanding of its duties relating to health and safety. It has structures in place for setting direction, organisational policy, and developing and producing procedures across the service. These support the strategic planning function and both tactical and service delivery areas. I think that's a fairly positive statement to make in general. There were 8 recommendations within the report, and also 25 areas for consideration. And again, it's an area that we haven't done before, is sort of splitting up recommendations from areas of consideration. And it's a bit of a moot point because the service has to have regard to the whole report. All we've done there is, I guess, prioritise what we think are the more important areas for consideration by calling them recommendations. But also within this report, we identified 9 areas of good practice, and I think that's an approach we'll continue with in future reports because it's appropriate to applaud the good work of the service and not only highlight the areas that we think there's room for improvement. The next thematic that's ongoing and is coming to an end, and it's quite appropriate timing, just following on from Mark's excellent presentation on high-rise firefighting. We have been carrying out a thematic inspection on the service's approach to high-rise firefighting. That report is now in kind of late draft stages. I think it's fair to say that there will be recommendations within it, there will be observations within it, and I think having watched Mark's presentation there, actually some of the recommendations are based on our snapshot in time when we carried out our inspection work, and the service has actually moved on since then and continues to move on, and that's the nature of inspection, isn't it? You can only take an image at a point in time. And a dynamic organisation like the Scottish Fire and Rescue Service, there are plans in place to improve almost on a daily basis. So some of the recommendations within the report you probably look at and think, we've done that, or we're doing that, or we'll be doing that by the end of the week, you know. That's just the nature of the beast, isn't it? It's a bit of a moving feast. So please accept that that is the case. We see it again as a very balanced report, and I came in earlier and applauded some of the work that's gone on through the Grenfell working group, the ministerial working group, and that joint approach to the Grenfell action plan. But also, I think, as I've said right from the start, we want to set this in the context of Scotland's built environment. So this is about Scotland's risks and Scotland's built environment and Scotland's high-rise properties, and not sensationalising it into something that it's not, because there are very different risks in other parts of the country, as we know. So we will very much keep it on rails in relation to the risks that SFRS responds to and how appropriate their actions are in doing so. And just to come back on the point about the London exercise, I made the point that the tablets that London Fire Brigade were using were deployed much earlier in the process, and I had observed that during the exercise that I attended. Like you, Paul, I observed the media release on the exercise in London just last week, and it was the exact same building that I had attended when I was down there observing the exercise. And I just want to set committee members' minds at rest that I also attended an exercise in Irvine and Dooncourt that SFRS have been running over a period of time, and actually the similarities were incredible between the two exercises and between the two approaches of the services. So I don't want you to think that London are streets ahead in relation to their response to high-rise buildings or their evacuation of high-rise buildings. I don't think they are streets ahead. I think the service on the two occasions I attended Dooncourt had actually moved forward significantly in the month gap that was between those two exercises. So the first time I attended, I left thinking there's a bit of work to be done here. And when I attended on the second occasion, I thought, my goodness, they've made quite a bit of progress here. And obviously there's still some progress to make, and I'm sure Stuart would admit to that, but it is a work in progress, but it's certainly moving in the right direction. And I observed the same things in London as I observed in Scotland. So just wanted to set your minds at rest on that. The only other thematic worthy of mention is the climate change, which we have really just started off, and it's climate change in relation to the impact on operational activity, increased activity through weather-related incidents, etc. So we've just kicked it off. We've just created a data request, and we've sent the terms of reference and that request to the service for consideration and consultation, and that will move forward over the summer, hopefully producing a report by next year. We do plan on starting a report on mental health and well-being, but it's not likely to start until September, October, and it's probably not going to conclude this financial year. It's probably going to drag over into the next financial year. And other than that, I have very little to share with you.
Thank you, Robert. Comprehensive view of your work, and very much embrace your positivity around all that your interaction with the service. So thank you very much.
Thank you.
I'm presuming there's no further questions from that, and Ross just wants to say something.
Thanks, Chair. And just very briefly, Robert spoke about very positive engagements, particularly within Angus. If I can just echo that on behalf of the service from our perspective, I've spoken to Stephen Wood and how his team found the experience and the report extremely positive. I know that there's positive discussions ongoing within the East to look at the service delivery area level of report, and likewise I know there was really the health and safety operational perspective report has been really positively received as well. So from the services perspective, just to thank Robert and his team for the work that they've done. We look forward to receiving the high-rise report, and as with everything, we will absolutely seek to take any opportunities to learn from it, and likewise climate change, clearly a hugely important topic that's already been on the agenda today, and we look forward to supporting Robert and his team with that work as well. So on behalf of the service, thanks to Robert and his team for a very positive suite of ongoing work. Thank you.
Thank you. Leslie, if this is really relevant, do it, but could you speed it up? Would you mind? Thanks.
I'll email it. Thanks.
Okay, great. The reason being is that I didn't realise there was a ranks meeting going on at 1:30 as well, so there's quite a bit of other pressure on us now. Thank you, Robert. Thank you. Moving on to item 13, value-added statement, something I drafted up and then has been top and tailed. It's basically the last report of this nature that we'll do, because we'll be going to a more assurance-driven report in the future. Do any of my colleagues have any comments or feedback around the value-added statement? Fantastic. Thank you very much. Committee forward plan. There's a couple of items, weren't there, moving from the strategy day forward plan. We'll bring in, and we'll do this behind the scenes, but we'll bring in the operational document review and the next generation of BAs into the Service Delivery Committee, and we relieved the strategy day of the burden of those. And items for consideration at the future IGF. I will bring up the ICT issues that we've talked about here. I think that's relevant. And in terms of board and strategy information days, development days, I don't think there was anything. I'll be giving an update to the board as I usually do, and I'll try and reflect the wide-ranging discussions that we've had here, and particularly the assurance that we've taken on certain aspects of that. So, review of actions as we culminate this meeting now. Ali, item 15. Action.
Thank you, Chair. Yeah, so just to briefly summarise 2 substantive actions that we've taken. First one being, as raised by Leslie Bloomer and with reference to the previous minutes, around the increasing call handling times, that further investigation to be undertaken to understand the reasons behind the increase, and that it would be appropriate for this to be included within the next service delivery update report, as timings appear to be stabilising. Is that correct? Or do we need...
Not quite. What I think we'll do is we will put, I'm happy to speak to you afterwards, but for the record, what we said was that there have been frequent conversations around this over the last 24 months or so, and that what we would, and we were pleased to note there was a stabilisation of the performance figures, and that there had been some work, investigatory or review work done on it, and we would just report that back in the service delivery update report. So it's really a quick summary of what had been done.
That's fine. We'll refine that wording for the action and then make sure, obviously, that's included within the service delivery update report.
Sincere apologies that I wasn't clearer there.
Thank you, Chair. Thank you. And then the second substantive action was for the SFRS operational clinical governance, and for the Chair to have a conversation with the newly appointed ACO of Training, Safety and Assurance for the role of the committee moving forward.
Excellent. Thank you.
Thank you.
Thanks very much. Agreed with that. Item 16 is the date of the next meeting, which is 30th of August at 10:00. Hopefully this will be a face-to-face meeting, and probably going to be down in Cambuslang. Further details to be confirmed on that. And unless, and I'm going to do something slightly unusual here, we would normally jump across to a private session now, but unless somebody is going to indicate to me that they would like to make a comment on the private minutes, we can conclude that now. Okay, so therefore then we're happy to sign off those private minutes. Thank you very much to all. Thank you to everybody for your valued input. We could spend 5 hours on this meeting easily and still not have enough time. Really, really good. And apologies as chair to everybody if we've overrun by a quarter of an hour, which is not something I like to do. But thank you, and I won't delay us any further. Thanks. Bye-bye.
Thanks so much, folks.
Thanks. Bye-bye.
Bye.